Here we are. Yes, up and running, working, ready to go. Becky, somehow we pulled it off. It all works. All right, everyone logging in here. Facebook, YouTube, Twitch is live. Welcome to the first chill, laid back episode of what we're calling the night shift temporarily. Becky, you unmute yourself and pop on here and say hello to everybody. Yeah,
Hello.
there it is. There it is. All right, so everyone who's getting acquainted here, this is Becky. She's been living behind the scenes of Shift for the last year, but she's running this boat, and hopefully we got this all sorted out. But yeah, happy to be here. And I want to give everyone like a little bit of a backstory here about how this started, and then we'll get kicked off. We got some really good guests with a bunch of questions that I've seen. One about Disney, and that's about all I've seen. So we'll see what happens. But so yeah, we wanted to start this. I wanted to start this 2 years ago. I always wanted to do a live Q&A show and thought it would be cool, especially to do something that's not related to like the business side of the world of Shift and things of that nature. And I had it for a long time, had zero time to do it. And then Gary Vee kicked off something similar to this like this. And I got definitely all the credit goes to him for doing it. His Dustin helped me out set this up. So huge shout out to Dustin. But so here we are doing it, whatever. And this is supposed to be the laid back chill episode. I got some tea. I have some popcorn, and we'll answer as many questions as we can in the next 2 hours. And hopefully it's helpful for people. If you guys could share this stuff, there's a Facebook and a YouTube link you guys can share. Toss it up on Twitter or screenshot, use the hashtag the night shift, and we will retweet people. Happy to get to as many questions as we have. It's probably going to be a show where we go more like depth over width. So we want to try to help as many people out as we can. And if that means the questions go longer, that's kind of what it's here for. So, we'll do as much more as we can. We got Nyalani over on YouTube. Hello. Nice to see you. How you doing? Toss some stuff in the comments. Let us know if you guys want to hear about anything. If you guys have questions, if you want to jump on the show, ask a question live, we're going to be doing a lot of these. And I think it's going to be something that people are going to really like. So what I want you guys to do is email Becky. She's got her own special sassy email now, Becky@shiftmovementscience.com, where she is going to be taking all the questions. She'll be lining up everything. Lauren, yes, it is. It's definitely recorded. So you can find them on Shift's YouTube channel after, and I believe Facebook has them for 24 hours, but Shift will have all of them on YouTube like permanently. So that's definitely the best place to find them, or Twitch. Twitch has a lot of like bandwidth for that. So that's where I would go first. But we'll try to keep them up as much as we can. And then we're going to see, we might put them up in podcast form. We don't really know what we're going to do with that yet, but if people want that, then we'll totally do that too. So that's the game plan. Email Becky, Becky@shiftmovementscience.com if you want to get a question and you want to come on live. And so we'll just, we got a lot to get through. I think we may have bit off more than we can chew with the amount of people. Hello, Wendy, what's up? We got more than we can chew, but we're going to try to go as much as we can. And I hope that it's all helpful for people. There's a lot of different questions that are probably going to come up. We have like some stuff for like new grad PT, gymnastic stuff might come up, whatever, business stuff, personal life stuff, what kind of tea I'm drinking, whatever floats your boat. Let's do it. So Beck, man, I guess I'm ready when you are. Let's who's first here? We got, I think see who we got. Yes.
What's up?
Hey.
What's going on? How are you guys?
You can hear us okay?
Yeah, I think we're good. You guys can hear me?
This sun glare is making me look very tan right now. I got my quarantine tan going on.
As long as it doesn't like blast your eyes through your glasses, you'll be all right.
No, I'm good.
How you guys holding up in quarantine? You good?
Yeah, we're doing all right.
Yeah.
We have our wine going on for the night shift.
Yeah.
We also have some popcorn.
Yeah, we got popcorn too. You guys know popcorn? I already want a sponsorship from a popcorn company. So let's get
Right.
on that.
You got
what's up, guys? What we got going on?
Yeah, man, just trying to survive, trying to do some more learning around this time. Like I'm sure, all of us in the PT world hopefully are, with some more downtime. So yeah, I mean, being fresh out, this is an interesting first year as a new grad PT.
Top year to be a new grad.
Yeah. So yeah, man, just trying to continue learning and everything. So we actually just started taking the online SFMA course this week. So that's been really cool. Yeah, I guess, a good place to start based on that is, I know from talking to you in the past, some of your thoughts on what Con Ed you found helpful, but I think, for any new grad out there, what types of Con Ed do you think is good to jump into right off the bat? Because I know, I've heard you say before, it's like deer in headlights when you first start, and that is absolutely true. So what are your thoughts on that?
Too.
Yeah.
Yeah, that's a good question. I mean, looking back, I mean, I think that it's hard to give a universal answer because half of the battle is always contextual to the patients that you're seeing in front of you, right? And so I think there's a few courses that are probably good for everyone to take just because they have a really good baseline. I think that other courses are more like specific to what is going to be in front of you, right? So like, for example, when I first came out, the SFMA was just starting when I kind of started. And so I was like, all right, this is definitely something that's probably helpful because it's just movement in general, right? So I want to say I have zero endorsement or ties to any course anywhere. So that's probably important. But yeah, like I thought the SFMA just made sense for me because it was a movement-based assessment and like kind of it universally applied to everything. So I felt like that was really helpful. And then also to like the McKenzie system, I took that early on because I was seeing a lot of people for general low back pain and neck pain, right? So those were very much based on like my first year out. I saw a lot of, I was in a general outpatient ortho clinic. I saw a lot of people for like non-specific low back pain, non-specific neck pain. That was like a third of my caseload, right? And I was like, all right, that's probably a lot of people I need to help out. So that was a big part of it. And then after that, like the SFMA and that together, I kind of felt like I had a baseline, but then I didn't really know how to treat joints, right? So then like I started seeing like post-op cuff repairs or slap repairs or stuff like that. And I was like, I have no idea what I'm doing. Like I got really good baseline education in school, but like in terms of like running the eval and then like half the eval is done, you have a half hour. What are you going to do day one post-op, whatever it is, like 8 days out, 10 days out. And I was like, I'm super timid right now. I have no idea what I'm doing. And so that's when I was like, all right, now I need something to help with the shoulder. Right. And so then I found Mike's courses online. He had a really good online course. And so I was like, all right, it was like, I mean, it wasn't cheap. Don't get me wrong. Cause like I spent like maybe a couple $1,000 on SFMA and McKenzie. And I was like, geez, I got to pull back and like spend a lot of money. So then I waited another 6 months and then did some like inner working stuff with our staff. And then it was like, all right, now I can take the shoulder course, which was pretty reasonable online at that point. So then I did that. And then I just kind of kept going like that. It was just like every new grad and every current PT, I don't care who you are, always has that like gut sinking feeling when someone's in front of you and you really don't know how to help them. And you're like, I wish I knew more about what's going on right now. And so that feeling is really comfortable. And so after that, I was like, all right, I got to learn, so that was kind of my approach. I don't know if that's the best for everybody, but I just kept chipping away at like that stuff. And then I got to like, the sports ortho side of my life, like 3 or 4 years in. And I was like, all right, now I need this SCS. It was like, okay, I'll take that path because I think that I'm seeing more athletes now. And then I was like, all right, now I need my CSCS because I'm seeing more like strength conditioning type stuff. So kind of a natural evolution, you know what I mean?
Yeah. So in terms of like how you'd break that stuff down and learn about it, right? Would you dedicate a certain amount of time in the day to this is my chunk of time to study the Con Ed stuff, right? Because we took the McKenzie course and you get a lot out of it while you're there, obviously, but you have to keep, going back and looking and learning. Like, so would you take a course and then say, I'm going to devote the next X number of months and like this amount of time per day studying this? And obviously there's so much else to be looking at, right? Because it's like, even though you're honed in on McKenzie, right, you're still seeing ankles, you're still seeing shoulders, you're still seeing elbows. How did you juggle all that different information early on to keep learning?
Yeah, absolutely. And this is 2-part. One is like every new grad, and me especially, I had like Con Ed ADD, right? I was like moth to a flame. I was like, new research paper, new course, new book. I want to buy this. I want to do this. And I was like, oh, I got to treat patients and do notes. It was like impossible to like get it all in. Right? And you look up and it's like 11 o'clock at night and you got to wake up for clinic at 5 and you're like, Jesus, I'm so tired right now. Yeah. I personally felt the best thing to do was to kind of just focus on one thing that was like my big rock, right? So for example, the SFMA, right? I took that course and I knew that every patient that I was going to see, I could apply that to, right? And then I even know like when I took the shoulder course, I was like, I know I have at least like 5 to 10 patients per week that have something to do with the shoulder. So whether it's like an elbow issue and I do a quick shoulder eval and I can use some of the skills, or it's a true elbow patient and I can just like, think about it in the back of my mind. I felt like it was better. And this is a mistake I made. And I think a lot of new grads make is they go to a course, they go pretty trigger figure happy on like using the applications, but they don't master the system really. They just like dry needle every possible body part they can because they just learned it at a course, or they run everyone through like a 2-hour SFMA. And there's like, it's the most exhausting process ever. I think the way to do it is bite off a small chunk of the SFMA and like use it when it comes up, and then practice with your coworkers or stuff like that, or practice with like friends of yours that like, I give a ton of free SFMA eval outs, like my friends and like, from the gymnastics team and stuff like that when I was just out. So I had a dry erase marker like version of the SFMA, and I would just like leave it on my desk and I would go through as much as I could in an assessment without looking. And then I would look over and like mark how far I got. And then I would go on with my normal eval. So it was like a small piece of it, you know what I mean? But you slowly got to and more and more. And then the same thing happens with like a shoulder stuff, right? You like look at all your assessments and things like that. And then you kind of like, all right, I'm going to try like these 3 or 4 exercises that I learned. I'm going to try like this manual technique. And you just do like 1 new or 2 new things a week. And if you had 1 new thing a week, right, by the end of the year, you're a beast with whatever that system is.
Mm-hmm. Yeah, that's a good point. And how would you go about like integrating the SFMA into the rest of your eval, right? Because doing it, like you said, the whole breakout could take 2 hours, right? So say you have someone that comes in with like generalized shoulder pain. Where do you fit in your special tests? Where do you fit in your, other stuff like that into that evaluation?
Yeah, for sure. And this kind of goes with all systems, I think. And I think so like now I use a hybrid model, which is mostly the champion performance system, because I think that's kind of the most complete for us and all our athletic populations. But I think it's best to do like every system has kind of a top tier that you run people through. So top tier patterns in the SFMA, or like McKenzie has its own little system, or PRI has its few things that you look at from the top down. So I would kind of incorporate it always. And everyone's assessment should get the top tiers, regardless of whether like, you're running someone through a neck eval and they have an ankle pain. The SFMA is like, check the neck. And like the person's like, why in the world are you looking at my neck? Like, we just run this on everybody just to be comprehensive. And we want to make sure we get a full picture. Right. And so the patient doesn't know what you're looking for. You have no idea at all. So if you just run everybody through the top tier of that test, and then if you haven't learned the knee yet or the hip yet in the SFMA, you just kind of go with your own basic assessment of what you know from school. And then as you get more comfortable, you see more hip patients, you start adding in more of like the hip assessment, right? So I would always run everybody through the SFMA or the top tier McKenzie or whatever I thought it was. And then I would kind of use my clinical judgment based on like, all right, can I apply the shoulder piece right now, or can I break out something else? And then I would, you slowly just like add more and more to what you know how to do, until the point where you're just like, you're kind of ripping through a pretty good, the subjective assessment should take 20 minutes, like to get a really good full assessment. But then in like 10 minutes, you can get through all your top tiers, a pretty good local shoulder eval, and have a general idea of what you're looking at. And then you can kind of knock out some special tests and stuff like that at the end to be like, all right, what's my general thought from the beginning? And like, let me just kind of chase that a little bit.
Mm-hmm. Yeah, it's good. It's good organization.
Yeah. So
yeah, get in there. I've been talking the whole time.
I'm like,
Ira.
So when you're at home and you're looking for like different things to start researching and stuff like that, do you find yourself picking like one body part to kind of hone in on for like a few weeks, or
how
do you usually?
So the way that I did it is and this is kind of what I think, I only did it because I saw this in successful PTs that I looked up to, like Mike and like Lenny and like a bunch of other people like Ursa early in my career that were helping me out. And it seemed like they would go depth over width. Like it's way better to spend time trying to really understand and master a problem or master a topic for a few weeks to a month and have a really good handle on it, right? Because if you just know like surface deep, when you actually get into the weeds and you get into a complicated patient, like you're kind of stuck and you don't really know how to navigate around it. It's only when you master like the basics of the joint and stuff like that do you really understand it. So whether that's, you spend 2 weeks on cuff tears or 2 weeks on, ACL like diagnostics or something like that. So I think the best example I have is like I started seeing a lot of people for like hip micro instability, like gymnastics and ballet and stuff. And I was like, I have no idea what's going on here. Like I got taught nothing like this in school. And so I had to dive into just like a huge PubMed review. And I found a bunch of the hip surgeons and a bunch of the authors that were kind of prominent in that area. And then I tagged them on PubMed, and every time a new study came out, I would just kind of dive into it. And then you just look around, you're like, all right, like is there a book on this? Is there a course on this? And if there's not, you just keep reading all the research that comes out and applying it the best you can. So like Mark Safran and a bunch of other people are putting out really good like surgical research on that stuff. And I just learned the anatomy as best as I can and the test as best as I can. I started kind of developing my own ideas. So I would probably dive into one thing for a few weeks. And then when you go home, you just have like a stack of like 5 papers. Like I'm going to read one of these every day before work, or half of these before work or whatever it is. And then you slowly chip away at it more and more. But sometimes I definitely have like a curiosity like pull. Well, I'll have to like look something up because I'm just like, I want to know. But for the most part, I try to stay like hyper focused on one thing. I do that in all aspects of my life, right? If I'll go like 3 months just business life, and I won't really do a lot of content for like PT, but then I'll switch back before I do something for like a talking event or a course, or like if I'm traveling somewhere, and I'll go super hard on just gymnastic stuff, and then I'll go back if I'm, I kind of like hop around like that.
I feel like there's not a lack of knowledge, but because there's so much, it's hard to like, you're just so overwhelmed by how much there is. You're like, where do I even start?
Yeah, Mike's taught me so much about this too, man. You have to have so many good filters on for high quality research and evidence, right? You can't, like, social media is brutal these days. Like if you listen to social media, we wouldn't treat anybody for anything because nothing works. right? Everyone's got an opinion backwards and forwards. Like you have to look up really high quality randomized control trials or peer reviewed journals from like, AJSM and stuff like that. That's like really high quality. And then you can keep that kind of in your back pocket for like, there's people in the PT world who always have a really good academic head on, and they're always kind of following the research. They're not just like clickbait headlines for like, the next exercise to make your hamstrings more flexible, right? They're like really doing long reviews on blog posts or like the videos and stuff like that. Like that's who I tried to emulate. And so if you have high quality PubMed journals, you have a really good search filter for who you like follow. And then you also have, a reliable mentor or somebody who can like kind of give you a way to apply that. I think you can kind of get out of the crap filter a little bit.
Yeah. So on the social media topic, what are your what are your thoughts on all the shade thrown towards manual therapy now, and how we see over and over people saying it creates like a model of dependency. It kind of makes the patient rely on you to get better. I think there's certain models, right? Like the cash-based model, they're coming in, they want that type of treatment, and they're paying a premium for that. What are your thoughts on that in like a general outpatient setting? Is it I don't know. It's just there's so much negativity out there with that I remember when we were talking about this, I was like, it's very nihilistic, and as a new grad, you're like, man, what am I even doing? A lot of the evidence says like manual doesn't work. Am I just doing it because that's what PTs have always done? What are your thoughts on that? I know that's like a crazy topic right now.
No, that's good. So there's the first layer to this is advice I think we should take to everything in PT and everything, honestly, like in the world of like how we approach it. Number one is you should never follow social media. You should do the damn work and look it up yourself and study, right? If you can have a super high level intelligent conversation about the neurophysiological, the mechanical effects of manual therapy, the centralized, the peripheral effects, like if you don't really understand the research, then shooting off on social media is not going to go well, because you need an expert's opinion on that, right? There's like so much stuff that I don't talk about in the PT world on social media because it's not my lane. So I think that's the first thing, is like you should really understand the arguments on both sides so you can make your own educated decision. And I think there's a lot of really good journals and things out there for these topics on both sides, rightfully so, because it's still back and forth. But you have to do the work to read all of that stuff first before you start, going crazy on it. But that being said, I mean, I've read a significant amount of it on it, and like all the way from like treating chronic pain early in the beginning to all the way treating like this super high level athlete now that's like Olympic bound and really thinks manual therapy is an important part of their session. I think all this comes down to the right application of whatever tool you're using, right? There's times when it's more about emotional intelligence and reading the room a little bit about whether someone's coming in, doesn't want to do exercise, doesn't want to do anything, just wants a hot pack and wants you to rub their back for 40 minutes, right? That's like a different situation, right? Than someone who comes in and says like, hey, I threw a bullpen last night and my shoulder's super stiff. Like there's good research to support that soft tissue stiffness occurs after high level athletics and repetitive motions, like you lose overhead flexion after throwing. So like in that case, if it can be a factor of like, okay, there's a little bit of manual therapy. If we have an objective test before and after, even if it's a temporary change, right? You get 5 degrees of overhead flexion back for a half hour so we can go load it with exercises, then I think that's beneficial. Same thing as that it should be a pretty comprehensive home program. This should be a stretching program. So if you look at all the literature and you realize like, all right, what can I do to make mobility and soft tissue flexibility improve, right? Well, I can do some soft tissue work. I can do some loaded eccentrics. That's pretty prominent in the research. I can do some quick manual therapy and have an objective change if that is neurophysiological, if it just feels better, if it's placebo, but we have some sort of change. We can also do some good strength conditioning programming, and then we can have some workload modification. If those 5 things are all in my tool belt to help somebody with mobility or flexibility, then I'm okay doing 5 to 10 minutes of manual therapy. If someone's paying me for it, they think that it's going to help them, and we have objective markers before and after. A lot of this is having a really good bird's eye view of the literature and applying it based on when it's there. I think anyone who lives on the polar end back and forth of like, we should never use manual therapy ever. Like, well, what's passive range of motion? If is that not allowed? Because that's manual therapy. There's that extra but like somebody post-op needs a good amount of, desensitization or neurophysiological, whatever you want to call it. If your arm's in a sling for 8 weeks and you come to PT and you need capsular mode, right? You need some soft tissue work to help you, and you need some passive range of motion. Those are all manual therapy in my mind. And I feel like anyone who says that we shouldn't use manual therapy at all, and then also doesn't want to use passive range of motion or that kind of stuff in joint modes, it's like, wow, I think maybe you're being a little bit too narrow-minded. Now, that being said, there's been plenty of people who I come in and only want soft tissue work and don't want to do anything. And I'm like pretty strict about that. Have a conversation, even if they're paying me cash based, like we're in the model where I'm like, hey, you're not going to get better if this is the only thing you want to do. If you just want manual therapy, then I think, we need to talk about like referring to a massage therapist for a 60-minute session, because I have 6 or 7 things that I really think are important to get through. And if we just sit here and plug away at this, it's not going to go well. So long answer, but deserves it because it's kind of a long-winded question.
Yeah, no, that's a good way to word it. I like that last.
Kind of going off what you were kind of touching on, like the post-op and where you would go post-op with someone. When do you determine how to progress somebody's strengthening post-op? Like I'm thinking about a bunch of rotator cuff patients that I have right now. Like what criteria do you usually follow and you're like, all right, they're ready to go to like active assisted range of motion or that kind of thing?
Yeah, there's always like 3 things in my mind right away that I'm thinking about is like before we even make decisions. So one is the surgery and the protocol, right? That's always probably the most important of like, especially with a rotator cuff like tear. You could have the same partial thickness rotator cuff repair with like an acromioplasty, right? And debridement, but that person, you can have one person who's super high level athlete, got it over time, right? Because they were throwing or they were going overhead, they did CrossFit or something like that. They have an overuse type thing, but they're young, they're healthy, they're really fit, they're active. The surgeon says the surgery was a breeze, didn't really go bad. They're super dedicated to their rehab. But that person is probably going to have a very different approach to their protocol than the 55-year-old fell while I was, changing, trying to get the leaves out of my gutters, an acute tear is like, not the most active person. Maybe they smoke, maybe they have comorbidities. Like that healing progression and healing rate is going to go way slower. Not to mention their tolerance to exercise, their ability to exercise properly and do it at home is way less. So the same, cuff repair, cuff thing with on paper, what looks like the same surgical protocol, you're going to have to be completely different based on what, is presenting to you. So surgery in the timeline of the doctor is always number one. I think more on the clinical side, you have to go based on pain and end feel. Significantly a lot of the time. So if you get someone who you're trying to range passively and their end feel is like, pretty good, they're really relaxed, it's like, that's not that sore, it's not that bad, and it matches their surgical protocol and they're feeling comfortable, you can test the waters and kind of dip your toes kind of maybe more in the protocol around if they have like an open-ended window, right? Versus somebody sick, the other person, right? They didn't do well after surgery. They got started late. They're in a lot of pain. They're still not sleeping well at night. And that person doesn't tolerate passive range of motion because it's real aggressive end feel and they're just like guarded or whatever it is. Well, that person's probably not going to tolerate jumping to active range of motion right at like whatever week mark it is. So that person you're going to have to kind of play with a little bit and maybe find different ways to go about it. So it's a little bit of a hard science and then it's a little bit of an art and a little bit of a feel is like surgery, timeline, comorbidities, whatever it is, but then also like the trust and rapport you have with somebody, do they have the way to do it at home safely without, making themselves too sore? And then it kind of has a natural progression there, but you always want to, I always recommend, and I got this from Mike, is you always want to test these things in the clinic and see how they respond before you put them in their home program. Right. And so like an elbow, for example, we'll say like the goal here is for us to gain range of motion when you're after your surgery, and then your job is to keep it. Like Mike's taught me that a lot. And so you never want to have somebody going home and trying to crank on their arm or their elbow. It's like, okay, we got 5 degrees more. Like, it seems like it's going pretty good. Just gently, consistently do this throughout the week. And then I'll see you again later this week and we'll keep going more.
Mm-hmm.
So
does that make sense?
Yeah, that does make sense.
Okay. So because we were talking about this, before too. When you add a new exercise, right? Are you someone that likes to only add one exercise at a time? So, if they're at home doing their thing and like they come in flared up the next day, all right, well, I've only changed one thing. There's only one variable here in terms of what you can control. And then, or do you like to give them several things? And then part of, home exercise too, how much are you giving people like when you start out? Because I think we both look at it like, man, there's a laundry list of stuff this person can work on. But a lot of people, getting them to do their home program is a hassle, is a task, And so you got to keep it simple. But so I guess the first thing, how many do you add and how many do you go for like total?
Yeah. So generally I would say less is more with changing variables, right? You don't want to do a new hands-on strength program and give them 5 new exercises, but then also change the loading and the sets and the reps of all that kind of stuff, because somebody comes back and they're sore. It's on both sides, right? Like if they get better or they get worse, you don't know why, right? So if they come back and like, oh, I feel amazing, man, whatever we did, let's do more of it. And you're like, oh, we did 10 new things. I don't really know which one was, you know. On the same side too, somebody comes back and like, my shoulder's real sore. I couldn't sleep at night. Like, man, I was really struggling the next day. You're like, all right, I really know how to change it. So I would say I usually try to manipulate like a few things. Like maybe we'll progress a few exercises, or maybe we'll change like the sets and the reps and stuff like that, but only like a few things, unless you're writing like a brand new program, right? And you're changing a bunch of exercises, but that usually only comes like, you know, every like month or so you're doing that. You're not really changing a ton of exercises side to side. We know a lot about PT. There's a handful of exercises for each thing you're going to do that you're probably trying to get back to, right? Like for lower body, you're trying to get back to some sort of like hinge, squat, lunge, single leg, and then some accessory hip work or whatever it is, or dynamic stability. Same thing for the shoulder. You're trying to get back to like horizontal pushing and pulling, vertical pushing and pulling, some dynamic stability and cuff work, right? Most people are going to start there and then you add on more as you go. So if you know that, you're trying to like make a base program with that, and then you kind of go forward. And I would say the next part to that question is, you know, I'd rather give somebody less exercises and have them be able to do them consistently than give them a whole bunch of exercises and know they're only going to do 30%, right? So I try my best to, when you think about how you're going to help somebody get better, you think about, all right, like are there range of motion things I need to help? Are there like strength imbalances? Are there movement patterns in general I need, or are there workload things? Like I'm always kind of in those buckets. So I'm trying to give them like 1 or 2 things, you know, to make a more complete program based on what the assessment is. Like, all right, we found like, you know, some hip stiffness. We found some, you know, I'd like to give them some sort of a hinge exercise because their hamstrings are maybe not as strong as they should be. We want to pull them away from some of their jumping and landing workload. And then maybe we want to give them some sort of like accessory work for their hip, right? So those four things there, I'd say, let's just do these 1 or 2 exercises for each thing. Maybe it's 5 exercises total. I'd rather see them do that, you know, 3 times a week, pretty consistently for 15 to 20 minutes, than be like, all right, here's 14 exercises with 7 different rep schemes. And then I want you to also do this side program on the side. Like, no one's going to do it. You know, we're all PTs. If anyone here is a PT, like watching the live stream, and they write a full program for themselves and actually do the full program 3 times a week when you're sore, you're kidding yourself. So how can you do it? You know, I skip my warm-up all the time, and I'm like, I'm going to pay for this later.
Yeah, right.
And
walk in 2 squats and then start picking the barbell up.
Yeah, I'm good.
I feel great.
Jeez.
Do you usually address like nutrition and sleep and hydration and stuff like that with your patients?
Yes, within my expertise. So I think that I'm pretty comfortable talking about like sleep hygiene and stuff like that, because it's just interesting to me and I've studied a lot. So I never mind, you know, talking to somebody about that stuff. I would say nutrition is definitely more outside my lane. So I usually refer to people for that, but I'll give general advice. You know what I mean? Like, I think we always phrase it in how can we optimize, this is for athletics as well. When I talk to like athletes and stuff like that are not injured, it's like, how can we just optimize you? We have to optimize the work half of you, and we have to optimize the recovery half of you. So the work side of you is going to be all the stuff we're doing here, the right exercises, whatever it is, the home program discussion. And the other side is like, we have to optimize the basics of how you get stronger and get fitter before we start throwing in like random stuff, right? So if you haven't handled sleep, nutrition, hydration, and stress management before we start talking about, should you buy a $500 vibrating gun? I think the question is a little bit in the wrong department, you know, and like those things have a role for sure, and they can be helpful. But if you sleep 6 hours and you eat like garbage, you don't drink enough water, and you also have 500 other things to do all day, and you can't actually focus on getting better, then it's kind of a moot point. So I would say I try to toss it in as like a, you know, use the most of you can right now. Like, try to get better sleep, try to like have pretty high quality meals, you know, throughout the day. And then like on the weekends, you can like enjoy yourself a little bit or whatever it is. It's different based on the population, because I work with a lot of like young female athletes sometimes. So I'm very careful with that, but definitely like the hydration, like the daily soft tissue work, you know, before you warm up and stuff like that. But you can kind of have an open-ended conversation and not really back somebody into a corner a little bit, you know?
Mm-hmm.
Yeah. We were toying around with the idea of like at someone's eval, just giving them like, I don't know if the APTA, I should have browsed around their website, if the APTA has any like general recommendations on sleep or nutrition. Cause I mean, you know, there's people that come in and like, you know, they're in, or like someone in chronic pain. It's like, how much of that is what's going on at your tissue level versus you're just not taking care of yourself. And sometimes we feel so limited in what our scope is as a PT that like these other issues need to be addressed, you know?
For sure. And it's hard sometimes because you have 17 things you have to do. And especially if you're in an insurance-based setting, you the insurance company telling me you got to do all these things and get your units and stuff. And it's really hard, but you can fill in some of that stuff as like just casual conversation while you're working out or while you're doing and stuff and whatever it is. And I think there are, I don't know if I definitely know the sports section and some other people in definitely the CSCS side of stuff have recommendations for some of these things. And if not, it's just general health and well-being. It doesn't need to be from PT, but like the 7 to 8 hours of extra of sleep and, some sort of high quality like meal throughout the day and stuff like that. I think most of those things are a little bit more common knowledge. I think if you err on the side of caution and don't pretend to be a nutritionist, you could probably get away with most of it.
Yeah. Even anything specific?
Yeah, man. Anything else? We're hauling ass right now. I like this. Though.
Yeah.
This is good.
Well, so I mean, I don't want to keep cutting her off, but we were talking about like exercise and adding certain variables, right? So in terms of like discharge planning, right? So say not thinking about a specific athlete with a specific goal, right? Because obviously your discharge planning for one of your higher level gymnasts is different than, the 40 or 50-year-old that comes in like after like a subacromial decompression or something, right? So if you're thinking about your average, outpatient person coming in, not necessarily an athlete, do you think about discharge planning with exercise? Like, all right, I wanted this guy to be capable with like a hinge, a squat. Well, say it's like a lower body injury, a knee pain. They're coming in for generalized knee pain. Are you thinking like, all right, they're going to be discharged when they can do a functional squat, they can do a functional hinge pattern, and they're not really in pain? Like, how do you think about the discharge planning? Because we feel like there's always stuff to work on. And, a lot of times it's either like, I feel like insurance is running the show, or a lot of times people come into me and they're like, my doc said, PT 2 times a week, 4 to 6 weeks. So I scheduled out the next 6 weeks. And it's like, they're going by the doctor's script of how long they're going to be there. And it's just like, man, where do you think about the discharge planning, like after the eval, either based on the patient's like goals, or if they don't have specific goals, because a lot of times their goal is just, I don't want to be in pain. How do you go about that? Are you thinking they should do these exercises functionally, or are you thinking like, let's just see when they're out of pain? Because sometimes that feels like it never happens either.
You hit the nail on the head already, man. You just said it comes back to their goals. And that's why originally one of our questions is, that's why I said you have to spend so much time on the subjective, because you have to start with the end in mind, right? If you do a subjective eval, and this is a classic new grad mistake, and I made it too, is you make a goal plan based on what you want to see them do, not based on what they care about, right? And so you never have a roadmap to their own goals. And, it completely falls apart because you're like, when do I stop? Are you better? Are you not? Are we even making progress? Right. So I think that's why at the very beginning, and one of the most incredible people at this is Dan Pope. Dan Pope dominates a subjective eval. He knows exactly what, he has to get. And I've tried to learn a lot from him because he has such a really good way of, not making it structured and like it's like an interview or like a very aggressive straight home, but he like just slides those questions in very easily. He's like, like, oh, like, what do you want to get out of this? Like, why are you coming? Like, what do you want to get back to? And the person, even if the general person is just in a lot of pain, they have things they want to do, right? And the average person, right? Take like the super most common person, like the 50-year-old with back pain. They're like, what do you want to do? Like, do you just want to like have any goals or whatever? Like, I just want to be able to get through my day without pain. I want to work. I want to drive to work back and home. I want to sit with my family on the couch and not have to worry about my back hurting. And I want to play racquetball every once in a while on a whim, or I want to go out and I want to golf with my guy friends every once in a while. Right. And like same thing with like some like just general fitness people. Like, I just want to get like a basic workout in and not have my shoulder blow out with me or something like that. So if you start from the beginning about like, all right, what were the first things that got you painful? And then also like, what do you really care about? What's super important to you? That could be back pain and golfing. That could be for anybody else. That could be, I want to train 6 days a week. I want to snatch 225, like whatever it is. If that's your benchmark and your marker to go by, then you always know you're making progress. And that's when I start to think about discharge and stuff like that. When someone's like starting to kind of feel comfortable getting back to some of that stuff, and their pain is not out of control, right? They feel like they have a strategy to do what they need to do and they can get back to it. But then also they know how to take care of themselves, right? Like, I'm always trying to get people off of like needing me. Like, my goal is to help you fix yourself, not me fix you. And like, there's a big business side of that. People are like, oh, you don't have any patients, but the referral rate and people who, come to see you because you actually get people better is super high. So it makes up for it. But I'm usually always like objectively looking at their goals. And there's always awkward moments when you try that thing for the first time and they're like, I know my knee's still kind of sore. And you're like, all right, well, it's okay. We're getting there at least. Like, I think people shouldn't be afraid to try some of those things, even if they get a little bit of symptoms, because if you never push the needle a little bit, how are you going to know? You're going to send somebody back out into the wild. They're going to get hurt again anyway. So you might as well, take your best shot at doing it. We have people, in the clinic doing some more dynamic stuff or doing whatever, because we want to test the waters. And if you can't, then you send them home with a home program that's like a little bit, like, oh, this might cause some symptoms. And you tell them, you're like, hey, we're going to try this. I think you've done really well for the last couple of months. And I think you're ready to try a walk jog program and see how it feels. And you give them guidelines. You say, if it's under a 3 out of a 10, then like maybe we're not super worried, but the next day it should feel better. And you shouldn't feel like any sharp, aggressive pain. It should be maybe just general ache and stuff like that. And so if those criteria are met and the next day they're feeling pretty good and you come back, you're like, all right, we're starting to get there a little bit, and you just keep ramping up their goals and kind of like how much is on a home program.
Yeah, that's good. And are you reassessing goals each visit? You're like, we were talking about, you want to drive to and from work. Are you going to be like, how's the drive going? How far into the drive are you getting pain? I feel like we had that aha moment like last week about, we know how important the subjective is, but establishing goals, because a lot of times I'll be like, so why are you coming into PT? What do you want to get out of this? And they'll say, I just don't want to be in pain. It's like kind of awkward. They don't really have any good goals, but probably just got to dig deeper, and figure out like, well, what's your day like then? If you don't want to be in pain, what does that look like throughout the day?
Yeah, so, I would say so. People have, I would say you reassess every visit within like what makes common sense, right? So someone fresh out of a cuff repair, you're not going to ask them every single day if they're like up, right? Like you're just gonna be pissing them off. I'm like, no, I still can't do it. And stop asking me.
So are you snatching yet? Oh wait, we're still at like no active range of motion.
Yeah, exactly. So that's like one part of it is like kind of the context, but I think you can always internally, you can always have that little barometer of if they're getting better, because sometimes we know objectively we see motion changes, or we see more range of motion without pain, or we see strength gains, or they can do stuff like that, or exercise progressions. And you can kind of highlight that, be like, hey, like we're making some progress here. And then you can kind of ask every once in a while, like, oh yeah, how's like driving here? Like, were you sore when you were driving here? Cause I remember like in your eval, you said like you couldn't even get out of the car when you were first in the parking lot. It was really bad. And like, oh yeah, you know what I mean? Actually, it wasn't that bad today. It was like annoying, but it wasn't as bad as I came, a month ago. And I was sitting in the parking lot for 10 minutes trying to catch my breath. Like that kind of stuff you can tease out more and more. And then if you kind of have like those smaller objective day-to-day goals, like I think something I learned from the SFA that was helpful is you should within a session be testing and retesting, even if the answer is not great, say, are you better, worse, or the same every time they come to the visit? That's a really good way to do it. Or just like a toe touch, back and forth after some manual therapy or after some exercise and stuff like that. Like you have a marker in between and say in advance, like it might not got better, but like we want to keep checking it. So if you have like the daily check-in, like, hey, are you better, worse, or the same? We have some objective stuff, and then on the table, then their goals. Like those are 4 pretty good metrics there of like ways to tackle it.
So when do you throw in the towel when you're not hitting those goals? How long do you give it? Because I also feel like sometimes we're just treading water. We're kind of plateauing. When do you kind of say, I think this is all I can do for you, and either refer out, or is there a period of time you give it? Do you have like we'll give it, we'll let this course of therapy run 4 to 6 to 8 weeks, whatever, and then are you like, because we have trouble with thinking about that too. When is it time to get the person moving on?
Yeah, that's super tough. And I think it's something that's really gray and it's hard to kind of interpret. So just from my experiences and seeing other people that I work with, it's like you want to give at least a few sessions to see if something's working or not working. So like don't expect a magic bullet. I think I fell into that trap when I was earlier of like, all done. It's like it's all better with my hands. So I think you have to give a couple sessions to be, better or worse, but then also a couple sessions where they're doing everything. You know what I mean? Like, I think you have to intelligently have that conversation professionally about like, okay, did you get all your exercises? They come in, they're like, I'm not better. It's been a couple, 3 sessions now. I just don't feel like I'm improving. All right, well, have we done all the exercises that we asked at home? Are any exercises bothering you? We should change. Do you feel like you've changed your activities? Like if you're still doing it, and sometimes they're just like, nah, like I didn't get to it or something like that. And you're like, okay, well, we got to kind of make sure that's going well before we say it's not working, because you can accept responsibility on your side. Be like, hey, if there's exercises that bother you, then like we can definitely change these things. You know what I mean? No problem at all. And then on their side, you got to be like, okay, but if you're still running when I said maybe let's back off for a couple of weeks and swim, then that's going to be a problem. So like as long as there's on both sides of the fence, people are doing it. If it's been 2 or 3 sessions and they're still not getting better nor or maybe getting worse, you say, all right, now it's time to pivot a little bit and figure it out. And I think you can have that open conversation. Honestly, people are more appreciative of that when you say like, all right, well, we tried some stuff, it didn't really work out, and like that's fine. But like Dan says all the time, he's like, PT is kind of like making soup. You like start with some stuff and you put some more stuff in and you like taste it. Dan has the best analogies ever. Stuff helps because you're like in the beginning, like, yeah, we'll give you some stuff. We think it's this kind of diagnosis, and then like we'll try for a few sessions, and if you're not better, then we'll change a few exercises, or we'll like try a different thing. And most people are like, all right, cool, like you're listening to me and you're hearing that I'm not getting better and we can change it, and they feel much more open to doing something. If somebody still doesn't get better over the course of like 4 weeks and all those things are going well, that's when you're like, all right, it's time to, I think it's time to either refer you to somebody else or like get you back to the doc, because maybe like, this happens a lot in shoulders, like 4 to 6 weeks. And like, especially high level athletes that are like, I have a big labrum tear. It's really bothering me. Or I have a cuff tear. I have a big competition next year. I'm trying to get recruited. Should I just pull the trigger and get surgery because off season's coming? And it's like, if you do 6 to 12 weeks of like conservative rehab, and I think some of the literature, especially on shoulders, like it takes up to 3 months sometimes to feel some noticeable change, and these can stick around for a long time. If you exhaust a really good program throughout those 3 months and you feel like you're making progress and it's still not going well. And I just had this happen with a kid who had a slap repair, a big slap repair. He tried PT for 3 months, pretty high level gymnast, and just wasn't getting over the hump, so to speak. And so it was like, all right, I think this is time, unfortunately, to do it. He's got a loose shoulder. He needs a capsular shift. And sure enough, when he went to surgery to, 12 to 4 slap tear, he had a biceps anchor coming out, he had a big acromion hook. It's like, all right, clearly we weren't going to make much progress here. But if someone's following all your advice and 6 weeks go by and they're still not any better at all, it's like, all right, we got to maybe try something different, a different provider. Maybe this isn't a good fit. Maybe I'm not your guy or girl. Maybe this is something you need to do on your own, or maybe this is like less visits, more home program, and just time. But something has to change by like the 4 to 6 week mark.
What was that question you had about frequency at home?
Oh yeah.
We'll make this the last one.
Yeah,
we'll
last question. So I feel like I've heard a lot of PTs be like, do this every day, like 2-3 times a day. What do you usually tell your patients as far as like frequency during the week for their exercises? Because I have a lot of patients that come in that are like muscularly exhausted. And I'm like, are you taking the rest days that I told you to take? And they're like, no, I do it every day, like 3 times a day. So I feel like I struggle with like how much is too much, and then like how little is too little kind of thing, like when to program in rest days and kind of something like that,
Yeah, so it totally depends on the goal, right? If the primary goal is like after surgery or something like that to get their motion back, then that's going to be a much more frequent thing throughout the day. If it's an exercise thing and if your goal is to get true strength or hypertrophy gains, right, then you have to respect the literature that we know on strengthening, which is the optimal dose and the optimal dose of rest is what gets you better. So you have to explain that early and say like, hey, like we have, we're going to load you up and go pretty well, and then we got to back off a little bit. So like maybe we just do your strength stuff 3 times per week, but we can do your motion stuff every day. Maybe you can do your basic range of motion soft tissue stuff every day, your strengthening stuff 3 times per week if you don't have symptoms, and if you feel like it's hard enough for you to kind of be tired, because we know the body kind of needs that cyclical wave. And even on the more macro scale is like week to week, I think we do a real bad job sometimes, especially with like ACL patients or cuff patients that are more advanced, about like a 2 on 1 off week or a 3 on 1 off week, right? There's plenty of times when I'm like, hey, let's just keep it pretty light this week. Like, let's have you skip PT for this week. Just stay on your home program and give yourself a little bit of a break. Keep your volume up moderately, but don't go much harder so that your body can recover. And then we'll go again for 3 more weeks. Like, I think you need periodization within the week. You need your linear loading for the loading, right? Or you can do your up and down throughout the week, but then you need your on and off days, light, medium, heavy days, and then your light, medium, heavy weeks. You need your cycles just like that.
Mm-hmm. That makes sense.
Yeah. Cool, guys. You crushed it.
We could keep going, man, but we'll let other people get their questions in. Really,
I feel like we're going to be doing a lot more of these coming soon, so you guys are welcome back anytime.
Awesome, man. Would love to come back anytime.
Good.
First,
take care, guys.
Thanks
Take care, dude. Thanks, buddy.
Later. All right, we're off to a good start. That's pretty good. All right, let me just touch base here. Who we got? Becky back in action. People just joining us. Becky, the one and only Becky. She is the brains behind this and is driving the ship. So, Chris, how are you guys streaming on this multiple platforms? I want to do something similar for our gym. So, this is a huge shout out to Dustin from Team Gary Vee. He helped me out. So, I was using Streamlabs and OBS and doing Zoom meetings with multiple monitors. It was an absolute nightmare. And then after I set that up and figured it out, and it was a lot of work, he then told me that they switched to Streamlab. StreamYard. So that's the software we're using now, and it's pretty awesome. I think it's pretty good. Becky and I had to do a lot of tests back and forth and make sure that we weren't, screwing things up, and it worked out pretty well. But StreamYard's pretty good. I think it's really valuable for what I'm trying to do with it. I think it gets tougher when you're trying to you can't really screen share. So if you're trying to give presentations, on Zoom, I'll do that sometimes if I host a Zoom meeting, and I want to show some research, or I want to walk somebody through a program, or I have a more private meeting, then I'll do that. But so far so good with StreamYard. I think we haven't blown it just yet, but yeah, thanks for listening, Chris, or watching. You're on YouTube. Thanks for watching. I think we had one more. Did somebody else say? Justin, what up, Justin? So hi guys, what's the email that we need to email questions to again? That would be Becky@shiftmovementscience.com, the one and only Becky. Becky has her own very fancy email address right now, so please don't spam her with things that are not it. But Becky is going to be handling all of the questions. She's going to be lining up guests. She's already done an amazing job now, and she, if you listen to the podcast or you watch the stuff on social for podcasts, that's all her magical editing work. So she's started. How long have you been doing this now? A year, maybe?
Nearly, yeah.
Yeah. So she started off with just I had my head sinking below water, and I couldn't get to all my things I needed to do. So she helped, and now she's the first official employee. So ta-da! So yeah, send them over to Becky if you guys have them. We're going to do as many live streams as people want. So this is just our first test run, but if this is helpful for people and they want to ask any question, then we will do more. I think the blessing of the quarantine, there's a lot of negatives, but the one blessing is that it's given me time to do more stuff at night, like now, because usually I'd be coaching right now. Shout out, I miss all the girls that I coach, but I'd normally be coaching right now and I wouldn't be able to do this. So as long as we're in quarantine and I can't coach, I'd be happy to help people out answering questions. Well, cool. And yeah, if you guys want to just do us a favor, just a lot of people watching on Facebook and YouTube and Twitch, share this, toss it up on social media, ask a question. You can come on video, whatever it is. But let us know what you guys want to know, and we will be happy to help you out. So I think we're ready for the next one. Beck, whoever you got. Oh, Jan. Can we get your audio sorted? Oh, look at you with all your books behind you. You're so smart. You may recognize Jan from every medical course that I've ever filmed. Jan was for all of our courses.
Yes.
How are you? How's your quarantine life?
Good. Life's pretty good. And we're in Virginia right now. So it's raining right now, but it was really nice earlier today. That's kind of like the theme. It'll start with a rainy day, then it'll turn into nice weather, and then it's back to rain. So, I mean, I'm fine with it.
We got destroyed by rain yesterday. It was I live on the third floor of an apartment, and I literally thought my house was going to blow down. So that's not very good. But
yeah, it's not good at all.
We're doing well today. It's very nice out today. So
that's good.
What do you got? What can I help out with?
I'm going to start with the best question we have. I know you've been looking forward to this. So word on the street is that you really like Disney. I mean, I know you like Disney. But if you envision yourself living as one Disney character, who would it be?
Where did that come from that I really like Disney? I'm not obsessed. I don't go to Disney World every year, but I do enjoy Disney movies. I just grew up I grew up in a super musical family, and I think I just got addicted to Disney movies because of the music and stuff like that. So, oh man, this is tough. So this is hard because the movie that I'd want to be in, I don't know if I'd want to be the character because it's not really a great, Aladdin is probably my favorite movie, but I don't know if I want to be Aladdin. That's a pretty rough journey he has there. I probably want to be it just for the music, but then I think my favorite Disney movie of all time is definitely Toy Story, or the Toy Story series. So it'd be pretty cool to be a toy and be able to come to life, when your humans go to work. But I don't know how that life would be because there's a lot of probably non-human things that I would miss, like driving a car or, going to concerts and stuff like that.
There's always their pros and cons.
I know, right? Absolutely. But yeah, Toy Story is definitely my top. I've watched that movie 100 times, but the music's not as good.
Yeah. That's what you like. You like the music.
Absolutely.
I feel like that's why I thought of the question, because I was I feel like that's something that you can relate to your patients with. You're
yeah.
Okay, what Disney song do you want to listen to today?
And yeah.
Okay, I think we're friends.
Totally. People who work with young patients, especially in the 10 to 14 age range, or have young athletes, icebreakers always are what are you watching on Netflix? What's your favorite Spotify playlist? What Disney movie do you like? Because it gets super awkward sometimes, and so I usually default to that. For the older ones, you ask you like Post Malone's new album, something like that. But for the younger ones, it's always Disney.
Good dad jokes always go.
Dad jokes too, yeah. They usually
see, that's for him. Dan Pope, though.
Dan Pope is king of bad jokes.
Speaking of that, I might as well go to my next question. So,
Sorry,
unfortunately, this is probably one of the most common questions during coronavirus. But what is your self-care routine, and what TV shows are you watching?
All right. So self-care routine definitely involves popcorn, but I usually have. So at first I didn't have any structure to my schedule. I had no idea what was going on like everybody else. And it was kind of like a whiplash. But now I like probably like a week into it, I was like, all right, I need like a new schedule. I need to figure out what I'm doing throughout the entire time of the day. So I usually sleep till whenever, just because like, virus immunity, that kind of stuff, sleep is important. So I sleep and then I wake up and try to not really do like anything technological for a while. And I think that's a big part of my self-care routine is like give myself an hour to just like chill, listen to music, like do whatever. And then I will, put out any fires in the email inbox first, and then I'll defer the rest of them. But then I usually work out after that. I like to watch the news, but I hate watching the media because it's a filtered interpretation of somebody. So like I'll try to watch some of the updates from like a live briefing or stuff, and I'll work out. So like kind of combats the negative aspect of sadness from coronavirus. But I think exercise is a big part of it. And then I try to keep most things the same throughout the whole day that I would normally do to kind of keep myself like in a good vibe, which is trying to, meal prep good food throughout the week. So I'm not eating junk, and I'm trying to like work in a moderate amount of hours and then like not do stuff at night. Cause I think that it's a habit we all have, is like, you want to work out every day and like work super hard all the time. And it's like very easy to get yourself into like rundown city, I should say. So I'm trying to do that. And then, I'm watching The Americans right now on, it's FX, but I watch it on Amazon Prime because all of my best friends from home in high school, we'd never seen it before. And we're having like a virtual book club. So like we watch 3 episodes a week and we like get together and like talk about it. It's really good. But I think like
fun.
those things, like having a show to watch. And then at the end of the week, usually during the normal like work week, I would like Friday or Saturday, I'd get together with a bunch of friends and like we'd go out and like grab food or stuff. So I've been trying to do a similar thing where like I'll grab a pizza or hang out and like FaceTime a bunch of my friends and we'll just like kind of kick it for a little while. So trying to keep some normalcy as the best I can, but like everybody else, it's madness.
Yeah, it's hard to stay social when like you're isolated from other people, but and the internet makes it a lot easier, which is good.
Thank God. Yeah. Can you imagine what we would do without the internet? Mike was just talking about this in our like champion meeting. What would you do without the internet right now? Would you like, what happened in the Spanish flu when you were just like, would you send like carrier pigeons back and forth, little notes on their legs?
I would order so many like books and like we'd just be reading all the time because I wouldn't have the internet to like look at resources.
The other cool thing about the internet now is like a lot of places like Skillshare are doing like free courses and stuff for like a couple weeks. Like I'm taking a well-being course from Yale, which is really good. And then I'm taking like there's like some new stuff on Skillshare for like graphic design and like some other stuff that I might jump on too, because it's like, I have some extra hours to kill right now. Why not?
Yeah, definitely. And a lot of like apps are offering free services for healthcare providers. I think it's like Headspace is a great app for like meditation and guided imagery, stuff like that. And it's free, I think, for a couple months. So might as well take advantage of it.
Highly recommend.
All right, let's see a little bit more of a PT question, or let's go with business. I feel like we haven't talked about business at all.
All right.
So I find it a little bit difficult in the beginning of my career to kind of sell my skills, mostly because I'm pretty fresh out of school. So when you first started your own business, how did you sell yourself?
That's a good question. I think early on it was more about having a unique point of view, like having a kind of a mixed approach to gymnastics. And for me, it was gymnastics and, physical therapy and like all that stuff kind of together was like maybe giving me some new ideas that I think some people maybe hadn't had before. So I was trying to market like that kind of stuff. Like maybe I have an idea that we haven't thought of before, or I've tried some stuff from the physical therapy world with the girls that I coach. And like, maybe that's going to be something interesting for people to learn about. So I think that was a big part of it. I think the other piece that I had behind me was I had the opportunity, especially early on, is like I had a year access to all my like journal stuff still and like school. So I was able to read a lot of, research and kind of stuff like that. So I think I was like, oh, a couple new journals said this or whatever. And I think people were interested in that a little bit. So probably that was in the beginning, but honestly, in the beginning, I didn't really market myself in terms of like forcing it on people. I just offered services. I just offered free stuff, because even when I started this company, like way back in the day, it was always about like just trying to like help people and like, give some new ideas. It was never about making money. So I was like, from a brand point of view, I was like, all right, well, I have to give away a lot of stuff to start with anyways, but the only way to build trust in a community and also like get people behind you is to like, prove that you're good. So I was trying my best to just like give free lectures, give free webinars, like do whatever I could. And I think that's where it kind of like got a foothold a little bit. So yeah, I think part of it is just understanding what you're good at and what you're not good at. And then the other part of it is you have to actually just step up and deliver, and people start to kind of get behind you a little bit.
Yeah, so I guess it's nice that you can use the internet as a platform to kind of provide those free services and like your blog posts and stuff like that.
Yep. And I think too, it's also just like in person too. Like when I was like going to congresses and stuff as a coach for the first time, and I got asked to speak because of my PT background, it's more about just like trying to build topics based on what people are asking you about, right? So like, what about this thing or that thing? And you're like, oh, I don't know right now, but I'll go back and I'll look it up and I'll get back to you or something like that. Or, you know, I'll try to figure out a way that we can maybe solve this problem or something like that. Like a lot of this stuff is just my own curiosity about problems that I was having in the gym or other people were having and trying to figure out what can be done about it, you know, and it opens a big rabbit hole of like, you know, stuff you got to try to figure out.
Yeah, definitely. What moment in your career did you feel like you kind of hit like a turning point, and you felt like your business kind of like skyrocketed? And looking back, can you kind of like pinpoint certain things that helped that happen?
Yes, that is a good question. Let me think. So I guess I'll just walk through the first 2 years. It was almost nothing. It was just like a lot of work for very minimal growth, I would say, so to speak. It was more just like, again, doing it because I thought it was helpful and people wanted to learn more. So it was more just like probably losing a lot of money. Honestly, you're just like chipping away, giving so much free stuff. But then probably like three or 4 years into it, like it started to stick a little bit because it was consistent message and it was new ideas and people found it valuable and it was helping people. So I started kind of getting more traction there. And that was maybe in like 2015 or 16. And then honestly, the whole scandal situation in gymnastics with, you know, the USAG stuff and all that, it was like this weird combination of like luck meets opportunity meets work. It was like I was already kind of like itching at like a lot of these things people were dealing with, and then like the whole scandal thing happened, and I think honestly probably the biggest takeoff when it started to become more like international contracts and it started to become more working with like the NCAA athletes and the elites was after I published the book. And so that was like, I think it was twofold. I think one is because there's no way that I could have put that out and charged for it and felt good about it morally. Like there's no way, because a lot of the stuff that I was talking about was the root, my opinion, was the root of why we got into such a hot mess in the beginning. So I didn't want to have to charge people for it because I wouldn't be able to sleep at night. There's no way I could be able to do that. So I think that kind of on one fold solidified my original intention, which was just like, this is just about helping people, not for money and whatever. But the second piece of it is I think that was an opportunity for people to kind of like really know that I maybe knew my stuff a little bit more. So I think after that is when people started to really be like, oh, this is interesting. Let's sign up for this. So let's have them out, or let's like, try to get a contract somewhere or something like that. And so yeah, 2016, probably after that whole situation is probably when it really took off. And then 17 into 18 was like pretty aggressive in terms of like traveling. So I did a lot of traveling in the States and then to a lot of other countries. And I think that was kind of like where we kind of leveled off. And then I think in the last year, it's just become continual kind of growth off of that. So just new projects, you listen to what people want, you make the back pain course, or I made like the Hero Lab because people were asking for it. So it's just like reading the market a little bit.
Yeah. So you made products that people were interested in, and then had them for free at first, and then decided that you could start selling the products and having the Hero Lab where you pay like a really, really small fee for getting like amazing resources.
Yeah, there's a lot of really good books, and I'll say advanced, like Gary Vee, for example, someone who I like really look up to as a business person. His content has helped me a lot in terms of like give it away for free and like don't worry about it, build brand, build trust, and then when there's something really valuable that you think is worth your time, because like I only started charging for stuff because I was spending so much time not treating patients and coaching that I needed the funds to keep the business afloat, right? And there's like a lot of really good books like Jab, 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 Right Hook he wrote, and then also another book called no, not he wrote it, but somebody else, like You Ask, They Answer. And like, it's just all about like, how can I help you, from like a business point of view? And they're like, oh, well, all my girls are like, have terrible shoulder flexibility, or like everybody has back pain, or, something else like that, especially on the more medical side, there's some stuff you can do there. So it's more about just like continuously just building stuff that, people find valuable. And then if there's been a ton of stuff that I launched, it didn't work at all. And it completely fell apart and it wasn't helpful at all. And I was like, all right, I'm not going to do that. But then there were some that were successful along the way. So you kind of just stick those.
Yeah, it's all a learning process, I guess, and you figure out what works and what doesn't work.
probably a 20-to-1 ratio of things that worked and went well to things that didn't work and didn't go well to things that actually did and stuck around.
Mm-hmm.
A lot of lectures to like 6 or 5 people, before they actually started getting a full room.
Yeah, get a good start with just a few
Yeah.
people, get all the kinks out, and then really like make it good with a lot of people.
In those early Congress years when, somebody else is giving an in-bar lecture, a release lecture, and you're like talking about Achilles injuries, it's like there's 2 people and you're like, all right, got this for an hour. This should go well.
That's good though. Because people can really buy into you, by all the products that you've made. And then eventually they're like, this guy is awesome. Like, we need to pay him for the things that he's doing. We need to go listen to him.
And part of it too, the growth of the company demanded more financial income, right? So like, if it's always the intention is good of like, I just want to try to help people and grow the business to reach more people, to learn things to help people, then it's like, all right, I don't feel guilty about charging, because like, I know that I take very little money from the company. I just pour it all back in. So like, eventually at one point when the podcast got popular, I was like, man, I'm the limiting factor here. Like, I can't do all this when I have other things going on. That's where Becky came in, because I was like, I need somebody else to help me like jump on all this stuff. And so it's like only until that point, but that was like 5 years into it before I hired anybody. It was only when the demand was there.
So we kind of talked about how you've done courses, you've made a lot of books that people love. Can you kind of just explain the process of what goes into making one of your books?
Yeah, it's aggressive. So I think it starts with the idea concept about like what's the need, or what's the problem, or what are people asking me a lot, or like, is there a pattern to all the people that I'm seeing? The first one that I wrote was in like 2015, which is like a back pain ebook, and it was because I just saw 500 people with back pain, and I was tired of seeing girls stress fracture their back and not get good rehab and then quit and then not be able to continue with gymnastics, right? Like, the value of gymnastics is why we're all doing this, to teach really good lessons and give a good experience. So if back fractures are the reason that people are not able to do that, then that's a big problem. We have to fix that. So then you kind of dive into the okay, what could be going on here in the literature? And usually before I publish anything, it's like 3 to 6 months of just trial and error, like in the gym or in the clinic or whatever I'm doing. And then you kind of get some good ideas there. You're like, okay, well, I think I see this pattern. I've read the research. I've treated some people and they've gotten better. So now that I think I have an idea about what works, I'd like to package that into a different context, right? So sometimes you package that in an ebook. Sometimes you package that in a live lecture and you record it, which has been really helpful for people. Sometimes you translate that into an actual going and offering clinic somewhere, which I did a ton of those in the first few years. Or sometimes it gets packaged in like a monster course like we're doing there. So yeah, you draft the ideas and then you solidify an outline and stuff like that. And then it's just like, it's really like just a grind, man. Like creating the big book was like a week by myself framing it. And then I went to a cabin for 4 days and didn't bring any technology and wrote the baseline. And then I came home and probably 3 to 5 hours a day for 6 months, I probably wrote consistently. And then it was another 6 months of like hiring my friend Josh to edit it, because he's super good with like grammar and like reading, and I'm not. So he did it, and then passing it off to a medical person, Haley, one of my old students. I was like, okay, can you read this and I'll help you out, right? And she went through it, and then I went through it again. So it was like a year or so long process, and most courses are kind of that same flow too. It's like the same kind of process, but there's just a lot of steps. And the first time you do it, it's a total botch it completely. It doesn't work out at all. And then as you get better at it, you kind of have a rhythm and a template. And I mean, I'm super lucky that I had mentorship from like Mike, who's like a beast in this area. So like he's helped me out a lot. So I try my best to do the same thing for other people who ask.
Mm-hmm. That's great. So how do you create such an extensive lit review for all your courses and books and blog posts? Like, where do you get access to all the articles, stuff like that?
Students. That's the benefit of having students. So some of it we pay for if you need a journal article like right away. So paying for it, but usually, honestly, it's through students that we have at the clinic or through other students that I've had in the past. And I just ask. A lot of the stuff is open access, unfortunately. So that's honestly, most of the stuff that I do comes from, I buy textbooks. So I'll buy, like, for example, when I was learning about the hip, I bought the 2 volumes of the surgical textbooks from Shane No, which are, for anybody who wants these things are beasts, but these things are like incredibly helpful for like all, and this was 2016. So it has all the latest research that you need, up until that point. And they don't go out of date super fast. So you can probably get, 2 to 3 years worth out of them. And then like you follow some articles up with there. So I usually read a lot of those bigger textbooks that I think are useful. And then I kind of talked about in the last with Kev is, you flag journal articles or authors who are really prominent in the literature, and you like kind of get updates about PubMed and stuff like that for a certain topic that you're reading on. And within gymnastics, like the stuff that we deal with when I'm writing those are like, instability and like kind of that aspect. I'm not going to be looking at a lot of like, I don't know, like compression fractures of the spine that a weightlifter might have. So it's like kind of the research funnels you down that way. So I usually try to keep tabs between books, research articles, PubMed, and then courses, like live courses.
Nice.
Yep.
Let's take a little turn of questions. So this is going to be more like social media, and that kind of stuff. So what video equipment do you recommend for somebody who's just getting started with social media and videos? And then what do you recommend for somebody that is kind of more experienced and wants to make more products that they're going to sell in like training programs?
Yeah. Do you mean more in terms of like what things I would study, like what companies are good to, or like what actual tools that I use, like the stuff I use to produce?
I guess like the tools, like if you were like, okay, I really like this type of camera as a startup, or you got to make sure that you have like a camera stand, stuff like that.
Yeah. So as much cheaper and free stuff as you can possibly do. That's the first place to start. Because if you're starting a business, or you're starting to get on social media, it's about the quality of the content and not the quality of the actual graphic, right? It's about what you say is more important than how good it looks on camera. So like in the very beginning, and I was using like basic iPhone and, just the mic that was on there and basic free graphic design from Canva and like PowerPoint and stuff like that. Like I really wasn't spending a lot of money on that stuff because I didn't have money to spend on it, but then also I didn't really think that it was like the most important thing. So I started off with just, free, Facebook's free, Twitter's free, Instagram's free, YouTube's free, like all that stuff. You can get tons of content and channels out that way. And then as I got a couple of years into it and I realized that I needed more, the rate limiting factor was my lack of education about digital marketing and about understanding the platform. So that's when I bought all Gary Vee's books. And I also am a huge fan of Digital Marketer, which is like a really big company that teaches this. So they have like a monthly subscription model that's like jam packed full of courses and stuff that I invested money into that. So I could like learn quite a bit about that. And then another one is StoryBrand. They're kind of more of like, how do you architect the right message? So that's kind of like my three hubs of like how I created the business and how it kind of took off was like Gary Vee's strategy. The digital marketer is more like in the trenches. What do you write? How do you learn to write copy? And like, what do you post and that kind of stuff? And then the StoryBrand was more like, okay, what's your message? What do you want to say? How do you craft a message that's valuable to a brand or something like that? So those were kind of the three that I used. And I found like those were really helpful for me.
Mm-hmm. That's helpful because not a lot of people kind of share that side of how they develop their business and like what apps they use, what businesses they promote. I don't know if it's because they don't want to be affiliated with certain things, but it's helpful to know.
It's not like a commonly asked question. Most people don't really, most people, especially on the PT side, don't really think a lot about marketing unless you had a marketing or like a business minor in college. So most PTs who want to start kind of a side hustle, as they call it, are just focused on the clinical skill or the in the trench skill. They're not focused on the, making sure it's heard, which I think is like half the battle.
Mm-hmm. Definitely.
Yeah, good question.
Take it back to the PT realm. So in a lot of your podcasts, you've done a great job describing super complicated things, putting it in a simple way. Do you have any analogies that you tend to use with patients in the clinic? So more specifically, like a better way to talk to young girls about maybe why they're in pain, and what it means?
Yeah. So there's kind of two layers to it. One is there's the more like, I guess the pain science world has a crazy amount of really good amount of like analogies and metaphors and stuff like that. So they talk about like the CEO analogy of like, your brain is like a CEO of a company and it's kind of like monitoring all the departments, marketing and like publishing or whatever. And it doesn't really get on a certain area of the body or a certain part of the company until, something goes wrong. So you like flare yourself up and it spends more time there, which is why maybe you have more attention on it or things hurt like that. So like pain science has a lot of really good analogies there. Dan uses the one of like the alarm system too, which is like, a normal alarm in a house is when burglars come, it goes off and it kind of sets yourself into an alarm state. But like now when you have a sensitized like, joint or something like that, like things that wouldn't normally set off your alarm are, so like leaves blowing by the house causes a pain response or a pain output. So there's a lot of really good metaphors from there that I think are really helpful in terms of like the actual talking to patients about injuries or things like that. Always dumber is better. Like your shoulder's like a golf ball on a tee, or like, your kneecap is like a train track with like a train driving on it. And sometimes when you turn it, like the train tracks can irritate the bottom of the train or something like that. I try to use those very simple analogies. And I think that definitely if in the sports world, you should always relate it back to their training or what they know. You know what I mean? So it's like in gymnastics, you can talk about how, we want to do a full assessment of, the way you move and things like that, and give you a really specific exercise for what's going to help you. Because, just like in gymnastics, if you do a giant and there's 7 things that could go wrong in a giant, it could be the cast, the swing, the tap, whatever it is. We don't know which thing is the problem. We don't know what to give you for a drill. And so it's the same thing with PT. It's like, all right, we're gonna do this big assessment. There's probably 5 or 6 things that could be the problem. It could be a flexibility thing, it could be a strength thing, but we're not going to know unless we actually test you. So we're going to run you through this assessment, and we're going to figure out the 2 or 3 things that we think might be the biggest, contributing factor. We'll give you a program for that, and then we'll kind of roll with that down the road. So I guess more specific analogies are helpful, but then also more like global analogies about like how PT works, how the body works, stuff like that.
I think those are so helpful because sometimes it's hard to like come up with the analogies yourself unless you like Google them. But if you hear somebody else say it, you're like, oh, that's perfect. I got to use that with this patient. So I find those super helpful.
You pick up a lot along the way too. Like it's just so important to have a really good mentor and someone who has gone through a little bit before, because you just hear like, especially in our clinic at Champion, it's like really good because we can all talk and go back and forth. But like you overhear people, talking, and like, you're like, oh, that's a pretty good way to phrase that. Or that's a pretty good way to kind of talk about that.
Yeah, that's definitely what I liked about my clinical at Champion. It was like I could like listen to all the different conversations and like be like, okay, I'm going to use that. Or like, it's in the back of my mind when I have a patient that's similar to one that I had seen in the clinic. So that was super helpful.
It's real. You have to surround yourself with people.
It really is. It's so true.
Shout out to Lenny. If Lenny's watching, I don't know who he is, but sometimes Lenny's like the funniest dude ever. He's super calm, relaxed. So every once in a while, he'll have like a complicated ACL patient, and he'll like rattle off all this stuff about like research and stats. I'm like, Jesus. I'm like, I don't know, like, where did that come from? And you're like, oh, I got a lot more to learn, I guess.
I know, right? Oh, so smart. Goals.
Yeah. Money for sure. Tag team.
So a couple more questions. I don't know. Do you have a little bit more time before we move on?
Yeah, fire away, man.
So this one. So I guess this is like in the clinic or maybe like when you're coaching gymnastics, but do you ever see yourself as a young gymnast in terms of like personality, their movement pattern, their work ethic when you're working with one of your athletes in the gym or maybe like a patient in the clinic? And does it like change how you're working with the patient or maybe like how you treat them?
Oh, that's a really good question. So the first answer is yes, for sure. There's definitely, I mean, everybody works with a bunch of patients, and like there's 1 or 2 like, Jesus, like this was me when I was 15 or whatever it is. And I think I definitely see it in myself and in a few athletes that I coach, particularly that I've had either coached or I'm coaching now. And I'm like, wow, this is almost eerie how much I feel like we're on the same path. But then also, certain patients that you connect with and just like have a similar story to you or like had a similar injury. And that's kind of why you got into PT or whatever your profession is. So it definitely happens. I think honestly, the biggest benefit that it gives you is way more empathy and way more connection with the athlete. I think that you can speak their language and you can say like, yeah, I know exactly what you're going through. Like I hurt my back too when I was your age or whatever it is. Or, I struggled with the same kind of skills or fears, or like, I had these issues too. And I think that when, it has to be professional and has to be more based on trust, but like when you can kind of have that, like go beyond the fourth wall, they say, about like kind of step into that layer of like, I'm not just your coach, I'm not just your PT. Like, oh, I actually really understand what you're going through. I think people are much more prone to follow your advice and really tag along. So I think it's really important for people, even if they don't, have the same hobbies or interests or the exact same thing, to try to connect with them a little bit about like, oh, I know what you're going through. Like I've kind of been there before. And I think that's one of the reasons why everyone at Champion and a lot of the other PTs that I really respect are so good, because they probably are into that type of sport that they're interested in. And so they connect with the language, right? Like when Mike says fastball, velocity, speed, spin rate, stuff like that, like the person's, ears perk up right away, versus like when I would say something gymnastics technology, terminology like Yurchenko or whatever, people kind of really understand you, get them. And I think you can kind of do that in either a specific sport way, or honestly, you could just do it by being active and by being like practicing what you preach. Like a lot of people will come to Champion and see like us working out, in the middle of the day. And like that adds a lot more, trust in our PT skills because we get it. So I think you can use that as a benefit to really connect with your athletes quite a bit more.
Mm-hmm. Definitely. Okay.
Yeah.
Final question. So what career did you envision yourself pursuing when you were younger? And if things are a little different than you envisioned when you were younger, are those interests anyway like tied into your current career?
Yeah, that's a good question. So interestingly enough, I almost did not go to PT school. I almost went into sound engineering and music production. I almost wanted to be like like an audio technician or something like that because I grew up in a super musical family. And I was really lucky. My high school had like a huge graphic design lab, but also had a music studio, like as part of our electives we could take. And if I wasn't at practice, I was just in that like lab, like 3 o'clock to 9 o'clock, and I would just be there the whole time. I just like really enjoy music. So like graphic design, video, audio kind of stuff, I was really set. I was like, oh, I'm definitely going that route. But then, gymnastics was a big part of my life, obviously, and like, injuries and wanting to give back and wanting to kind of be involved. Like the human body was equally as curious for me as the like the audio stuff. And I kind of thought about long-term plans and like what was a better career choice in terms of stability and financials and things that I could keep kind of investing. I viewed, for me, I didn't have as much passion as it. So I put gymnastics and PT stuff as the priority and kind of like that as a hobby. So I kind of had that as a side gig. And then I actually thought that I might have wanted to go into be an orthopedic surgeon or a physician's assistant or something of that nature. But then I kind of read into it and saw like how much, work it is, and not only the work, but how limited time you have with patients. And that was kind of my deciding factor, was like, I don't want to see people for 10 minutes or only when they're unconscious during anesthesia, big impact on their lives. But, 10 years worth of work and not having a real connection with your patient is kind of tough for me. So that's why I went the PT route, and then, had quite a circus to get into it. It took 3 tries for me to actually get transferred into my program, but worked out in the end.
Yeah, you got there.
Yeah. Three times. And then I'm sure many people know that I actually got kicked out. So 3 times in and then kicked out, but made it in the long run.
Yeah, that's all that matters. You're making a difference. So
Yeah. Doesn't matter how you get there.
Yeah.
Shout out to anybody that failed the clinical and thought their life was over. It gets better, I promise.
Yeah, there's always a downhill, and then you just keep chugging your way up.
Mike Ronald failed his ATC board, so we talk about that all the time, back and forth.
Oh, really? Yeah, I mean, all these exams are hard. Life is very stressful at times, and you just gotta keep chugging along, and you'll get where you want to go.
Absolutely. Well said. How motivational.
Thanks. I learned it from the best.
Is that it? Is that what we got? You all good?
Yeah, that's all my questions. I believe.
Yeah.
Maybe I missed one or two, but we'll move on to the next person.
We got through it all.
Yeah.
Well, thank you, Jan. I appreciate
You're
those
welcome.
questions.
Thanks for having me.
No problem. I hope you have a wonderful night. Stay safe in Corona.
Thanks. You too.
Yeah. See ya. Yeah, we're doing good, guys. This is solid. Anybody just joining the live stream? There's a lot of questions that have been coming up on YouTube, Facebook, Twitch, whatever. The way to get a question for a future episode is to email the one and only Becky, and she's going to pop on screen in a second just to say that. But Becky is, hey, there we go. Becky is running the show behind all this. So if you guys want to come on and ask a question, or you have a few questions you'd like to ask, Becky at shiftmovementscience.com is your go-to. She's going to be handling all the background puppeteering of this. She's probably making faces on comments everywhere about me behind my back, but I'm
just a couple.
But yeah, she's kind of handling all this. So I saw a bunch of comments coming in back and forth, whatever it is, and it's hard to talk and look at the comments at the same time. But email Becky if you want it. Oh, there we go. Sweet. This is like board. Oh yeah, for sure. This is a great question, and this is impossible to answer without context. So I think this one and another one that I saw. Yeah, for sure. So Chris Calvert, first of all, thank you for listening. I appreciate that. But email Becky. We can get you on a future episode because I'd love to hear exactly what you are trying to get out here. And it'd be better to talk about it real forth back and forth a couple times besides just giving you a blanket answer. So I have a feeling that you're going to do be really helpful for people. And we've already had a bunch of other questions for a future episode. So I don't know whether we do this twice a week, maybe once a week on Tuesdays or Thursdays. I have no idea, but it's early in the morning for Becky where she is in Australia. So we have to go based on Becky's schedule. Just kidding. All right. I think we're on time. Look at this. Hour and a half. Dang, look at us go. Let's do it. Who we got next? I think it's Shelly.
Hello. What's up?
Whoa. What's going on? How's your quarantine life?
It's good. It's good. This is actually my first full week of full quarantining because I've been full-time at work, but I'm not this week.
Oh my goodness. I thought you were going to say you were, around somebody who had COVID and you had to be quarantined. I got scared.
Well, actually, I was.
my
As of
God.
last week,
Okay.
yeah, as of last week, yeah, I'm good. I got tested. I have no symptoms, so hopefully I'm
You have a
fine.
nasal
I did. I had to do a self nasal swab. It was awful.
That's the
May
worst.
have lost like a few brain cells, but I'm good. I'm good now.
Awful. But
Yeah,
are you negative? You got tested negative?
I have not heard yet.
Oh my God, that's the
So
worst.
hopefully so, but
Cross your fingers.
yeah, fingers crossed. I have no symptoms, so should be good.
Sweet. Well, what can I help you with? What questions do you have?
Well, my first question, I'm going to piggyback off of Jan. What
Yeah.
is your favorite new Disney live action movie?
Oh, you mean like the remakes?
Like the new movies.
I don't know. Does Lion King count? Because it's remade live action, but it's all
That
graphic
counts?
design.
Yeah,
I
that
think
counts.
that one's pretty good. I can't remember. I'm not gonna lie. Back to the first one. If it wasn't for Will Smith, I think Aladdin would have been a bomb. I really
Oh,
think that
yeah.
Aladdin was on potential to be good, but then didn't really go great. And
Yeah,
Will Smith crushed. I'm a huge Will Smith man crush, by the way. So that was good. But yeah, probably I have to go with The Lion King because the cinematics and the graphics were like ridiculous. Like I was like legitimately scared watching, even though I know exactly what's gonna happen. I was like, Jesus, my heart is racing right now.
I know. People actually criticized it for being almost too real.
Yeah, I don't know.
Yeah,
It
but
was
I don't know.
it
I
was
thought
good,
it
man.
was pretty good too.
Can you imagine how long that takes to to make the hairs like blow in the wind?
I had no idea. No idea. I like Jungle Book, but
Mm.
can you imagine? I mean, Mowgli. He's one actual human being in the whole movie.
Yeah. Wait, what was it? Was Beauty and the Beast the first one they did?
uh,
Mhm.
Potentially.
That was good. I like that. It was good. The music in Beauty and the Beast was killer.
Yeah, it was good. I think they're coming out with Milan soon, maybe.
Yeah, no.
But
I don't remember the whole list. Dumbo? They do Dumbo too, right?
oh, have they? I don't know about that one.
Not gonna lie, I don't know if I've ever seen the original Dumbo.
I
So
don't know that either.
vote in the comment section, everybody. But I don't know if I ever. Maybe when I was really little, I didn't see it, but I never watched the Dumbo. My bad.
I actually don't know that I've seen that one either.
That's all right. There's plenty of
Add
time.
it to my quarantine list.
Yeah, Disney Plus is crushing it. Right?
Yeah. All right. My first question is in regards to just kind of making the transition from student to practitioner. I graduated last May and started practicing, and I feel like one of the hardest things for me was just trying to learn how to be an independent practitioner and not rely on feedback, because I have an absolutely incredible mentor, and that was something that I definitely looked for in a first job. But just how to, because as a student you're constantly getting feedback, good feedback, bad feedback, how to do things better, that kind of thing. And I felt like for me, I then relied on that feedback, and I needed that feedback, and almost as if I like didn't trust if I was doing things right. So I guess just like how that could have been smoothed over.
Yeah, I think the mentor thing is the biggest mistake that I made. I think that I at the time I took a job that was good. It was close to me, and it was a good orthopedic job, and it matched what I needed at the time in terms of proximity and because my loans were starting and stuff. Like I think it was good that I took that job, but I didn't have a really good mentor. I didn't have someone who could kind of not like always be on me, but like just be there to bounce ideas off back and forth, and like had 20 years ahead of me that I could like. I got in hot water with a tough situation, I could ask or stuff like that. So I think that I would have, looking back, I would have happily, and I should have lived a little bit more frugally and not spent so much money to take $10,000 less to get a better mentor somewhere, whatever that means. So if you can do that, and that's my advice to pretty much every new grad that I talk with or who comes to me and works as a student, is if you can find a way to like slow the process down of the job interview and like really ask about mentorship and Con Ed. Are they going to pay for Con Ed? Are they going to help you? I think that's really, really important. And if it means that you have to drive a little farther to work, or you have to get a little bit less money, or whatever it is, I think that's probably most important. But not everybody has that option. And that's where the blessing of the internet comes on too, is there are so many good groups now that have virtual mentorship, whether that's a strict PT group, but you can join like a forum or a Facebook group, or like a certain evidence SIG or something like that with the APTA. I think having some sort of somebody to bounce ideas off back and forth. And for me, that was Urson Religioso. When I first started out, it was like I was really in over my head with chronic pain and with like some of the McKenzie stuff, and he's an expert in that kind of stuff. So I forget exactly how it started. I think it was honestly just that I was like starting to put content out online, and I think he saw that I was really interested in working hard and putting in time to get the right information. And he was super nice and super generous that he helped me out really early on. And so, I was able to kind of chat with him back and forth and get a little bit of ideas. And I joined his inner circle at the time and whatever it was. And so that's kind of how I got it, was virtually. But then after I learned the value of how much that was important, I was already going to start seeking a new job because of like my SCS was happening. I wanted to work with more athletes and stuff. And then just through a combination of all the work I'd been doing online and luck, I met Lenny at I met Lenny at an SFMA 1 course with Urson, ironically. And the process started from there as I was shadowing Mike and Lenny with the elbow stuff because my SCS, I'd never treated a UCL injury before at that point. So yeah, that happened there. And then Mike and Lenny became the newest one. So I probably have like 1 or 2 mentors for each aspect of my life, right? Like my business, PT world, my kind of personal life, my more gymnastics type stuff like that. So I think it's good to have, 1 or 2 in these little facets. If that makes sense.
Yeah, definitely. I feel like that was one thing that I really learned from you and my other CIs on my rotations was just the importance of having a mentor. And thankfully, like, I was able to get that. And so I guess like, I felt like I had a lot of feedback and I guess I became like really reliant on needing feedback and on needing, and like the good and the bad, not only like, oh, I could have done this better.
That's maybe you should over depend on feedback first. It's better to be over and need it than like, like, nah, I got this down. I don't need anybody's help. So don't knock yourself for that.
Okay. I guess I like just felt like I was like constantly needing that versus
Yes, you should.
Yeah. Okay.
Even now, like these days, like I'm 7 years out right now, and I still, Mike and Lenny are right next to me. I ask them all the time for help. And like, there's been plenty of times in the last year alone that like Mike has just like, texted me after work or like pulled me aside and like, hey, like I would just do this maybe differently next time. And I'm like, totally. Yeah, it makes sense, man. I'm totally open to it. Like, I think you should never have that mindset of like, even when you become like the person, maybe in 20 years, I become that mentor. I'm still always going to have people that I hope kind of, push back a little bit. I mean, make sure that I'm staying in my lanes.
Yeah. Awesome. Okay. So this is kind of going kind of more in the, as a new grad, I feel like, obviously you have a really big social media platform and online presence and doing a lot of courses. Do you feel like in order to treat athletes and to reach those athletes and gymnasts and other sports, do you feel like you need that social media platform, or do you feel like, just like getting out, having that face-to-face interaction and just, kind of being more on the just clinician side is enough?
I think it's both. I think in our modern day and age, you have to have both. I think that my popularity grew, or my awareness grew. I think popularity is a terrible word, but my awareness grew of my brand and of my content because I was doing a lot of, at that time, tons of blogging, right? Just like blogging once a week, twice a week, consistently about topics that were valuable, even if like 3 people read them, which was very much the situation for a while, right? But it was a combination of doing things online and getting awareness out there and learning how to use the tools as they're designed, but then also FaceTime, right? So being able to, interact with people live and go to Congress, or like for gymnastics, go to Congress, but like go to meetings, go to clinics, talk with people at courses. Like I was doing so much on the weekend around just my treating hours of just like going to courses, talking with people online, like trying to make that balance of like doing stuff from home and publishing, but then also being in the face-to-face kind of scenario. And I think really early on, I was giving away a lot of free lectures. I was going to gyms and offering free lectures. I was doing some more like, clinics and stuff like that, like around when I traveled. And so that became of a little bit more of like okay, if we do this, I don't mind me not making money, but we got to cover the expenses for like people to travel. And so then it became like weekend seminars where I would travel once a month or twice per month to like give a bigger clinic for a day. And like, that's how it kind of grows organically in your niche. Now I haven't gone to a lot of PT conferences just because it's not really been something I've been able to get in my schedule because I'm a little bit busier, but like all those things should be on your avenue. You should try, like if you have a brand and you have something you're really passionate about and you love doing, you should try to create a social media presence that's high quality and consistent, but then also don't be afraid of like the live lectures, giving away your time, giving free screenings, talking with coaches, talking with other medical providers, surgeons, stuff like that.
Okay. Cool. I've gotten a little bit of feedback from just with the job that I'm at right now. I feel like they have a movement screen and it's we've done really well with it. I'm still kind of in the training portion of that. But I guess I've gotten some feedback where some people say that, it's better to do the free stuff, give it away first. And like you said, with some of the other questions, then that'll kind of be reciprocated. But then some people say that if you give it away free, then they're going to expect it for free. And if you give away some for free, then other people, when do you draw that line, I guess? And do you just say initially okay, I'm going to do 5 screens and see if you like it, and then see how it goes from there? Or I guess when do you draw that line?
Yeah. So very good question. I think it's a trap that a lot of PTs get into too, and especially new business people, what's the balance there of giving versus asking? And I think there's 2 ways to go about it. So one is from the beginning, you have to clearly delineate, what you're going to offer for free versus what might be a paid service. So you can be okay, well, I'm happy to come in and give a little bit of a lecture to the girls. I'm happy to, screen some people for free that are just more movement screens, not injuries, or screen injuries that are maybe starting and tell you, should you see a doctor? Should you just rest or whatever? But you say, but if this becomes a situation where you need a full medical assessment, I can't do that here. I need to do that in my clinic, and I definitely can't do it for free. So it's that's a whole hour of your time versus you just volunteering or giving away some basic stuff like that. I feel that way with information too. I always try to err on the side of giving things away and trying to help people, and it will come back around in the long run. But that being said, I feel okay giving out blog posts and little things here and there, but if this is a full comprehensive assessment of everything that I do, and this is how I make my own money day to day, I don't feel comfortable trying to express that in a short blog form because it's going to be impossible and it's not going to do it justice. So that's a situation where a full course might be something that you can charge for. You can be here are all these things that I use, these tools that I think are there. But if you really want to learn, if you want to use my services for what I'm really good at, my craft, I think that's a situation where we should arrange some sort of a payment. And I think that the people that I learned from the most, Gary Vee and them, would agree with that too. They'll give a ton of stuff away for free. But if you actually want me to do this service for you and make you a program or make you a plan or work with your business, especially consulting wise, I think that's when you're okay, this is going to be more of an exchange or something we can work out back and forth.
Okay.
That makes
cool.
sense?
Yeah, it does. So if you were to, develop a relationship with the gym, it's someone who's kind of brand new, maybe they've seen some of the newer, maybe they follow you, maybe they have seen some of the newer research, but they have had really no direct contact with anyone. And you were the first person to come in and do something like this with them. What would be your first thing that you would want to do a little, 30-minute seminar to the girls or the coaches or the parents? What would be your first thing for them?
Yeah. Well, I would first start with having a outside of the gym, lunch or coffee meeting, every once in a week. And you go to their gym and you watch practice, or they come to the clinic, and if their patients are cool with it, you can watch them go through PT. So you can kind of learn about each other in terms of what services you can exchange. But then also I think more important is moral alignment and ethical alignment. Do we believe in the same things? Do we have the same goals? Are we going to do this the same way? Is this a good fit? So I think if you skip that step and you try to start offering services, you run into big headaches down the road when you get into friction. So I would start there. And that's, again, volunteering time and stuff like that. And then once you establish that conversation about okay, I think we see eye to eye and we agree we can help each other, then you start asking about okay, well, and this is a mistake that I made, is I would always say okay, this is what you need to do. You should fix these things, versus being what do you think are the problems? What do you struggle with the most? What do you think are the biggest issues in your gym? And 9 times out of 10, you're going to get something that's probably not the biggest issue you have to deal with, right? For example, so when I first started, I knew that landing mechanics were a big issue, and I knew that strength conditioning was a big issue. But one, if I tackled that right off the bat, it would have been offensive. And 2, it would have been a very, very big cultural friction point, versus me asking them okay, what do you think you guys struggle with? All of our girls have some knee issues, or they're not fast enough, right? A lot of people have that, they want power, they want flexibility, they want strength, they want to perform better, they want routines, right? So okay, you take their goal and you reverse engineer that back about okay, well, what are the reasons people could be getting knee pain? Maybe we need to do some strength conditioning stuff because that's going to be something they jump on right away. Or maybe we need to do some more a couple new stretches or things of that nature that maybe you're not getting your quads really, you're just stretching your hip out, your hip capsule, your back out. You tinker with those things first. And then once you have your foot in the door and you've built trust, you say, okay, and by the way, I think that the way we're landing might be a big part of this, a month down the road, once they kind of okay, this guy knows what he's talking about, she knows what he's talking about, then you can kind of chew on that next bigger rock. And same thing with the strength conditioning stuff. If they maybe should be doing some like external loading, or that they should maybe not be doing a few exercises that you're nervous about. You talk first about their like, okay, if you want them to run faster, well, we definitely need more hamstring and glute stuff. I think that you guys are really good at developing your quads, but I don't really see anybody doing any like hamstring specific stuff, or not enough of it. Like, I think if you want to get faster and run more and also have less knee pain, adding some like, basic hamstring curls in or something like that would be good. And then you talk about like, hey, a month later, you go, the really exercise that you really want to work is probably a deadlift. So I think it's probably worth our time to teach these kids how to deadlift right. We'll do a glute bridge right now, a single leg hip lift for now, but then we really need to teach them how to deadlift in the next summer or something like that. So you kind of like chew on the things that they really think are important. And then you kind of like, you kind of build that relationship that way with it, versus like kicking the door in and being like, you're all ending wrong. And like, you should be doing this. Like, you're definitely being invited back.
Okay. Okay, cool. Yeah, that helps a lot. Thank you.
And also back to your first question, is that's what you give lectures on. You're in the gym,
Okay.
You're giving that real, but then you're like, hey, coaches, can you guys, for a half hour at the end of the practice, like have the older girls go through a stretching and a cool down. We'll come and we'll grab some food, some snacks, and like we'll do a 30-minute in service real quick on like how to do a hip lift the right way or whatever it is.
Okay, cool. Yeah, that's very helpful. All right. So kind of going into when you evaluate a gymnast or an athlete or really anyone, obviously like, doing an entire like biomechanical evaluation is really important for athletes, really for anyone, but especially athletes. But how do you, obviously as you go through all of those things, you're likely to find asymmetries and, a whole laundry list of things per se wrong with them, or, that meet your criteria for things that we would want to correct or work on. How do you prioritize what exactly to work on with someone without giving them a long list and without, overwhelming them with things?
Yeah, for sure. So very good question. Definitely something that everybody struggles with. You got to try to categorize your big rocks, right? Like when you get through an assessment, like what are the biggest things that I'm trying to attack? Because I think those are the most important issues. So say, for example, you have someone who has like low back pain, for example, and you're like, okay, we'll talk about a general low back pain, not a gymnast, but you talk about like when you hear their symptoms and you're like, okay, like it hurts when I like sit, when I bend over, like, I sit at work all day long. So that you're like, okay, well, seems like it's flexion intolerant. And that's probably the biggest thing to tackle, is like less flexion to take away some of your symptoms initially is probably the most important thing. So you note that when you're going through your subjective, and then you obviously follow that up with an objective, like an assessment, and be like, okay, directional preference makes sense. And then maybe as you're moving more through the exam, you test out some hip mobility, you test out some core stuff. Maybe their core is like not really the most efficient, or they don't really understand bracing when they're lifting something a little bit heavier, like a box off the floor. Or maybe their hip mobility is really, really jacked up and they have no hip flexion. So you're like, oh, maybe this is rounding you into flexion, like when you're doing some stuff more. And maybe if we get you a little bit more hip mobility, you could do a better hip hinge to pick this box up off the floor. So you kind of have those three things in your mind. And then you also find an ankle mobility restriction. You also find some T-spine issues. You also find, a whole bunch, a weak glute med, like on an MMT stuff or something like that. And like, so like, all right, well, like these things are like maybe what I should tackle first, because they might have the most bang for my buck, but I'll keep note of these three things or these four things that I found, just in case one of these things isn't really helping, and I can switch out and maybe see something else of the idea. So the first thing I would do is explain to them what maybe makes the most sense. And I was like, okay, so I think if these three things are important, maybe we should try to sit with a towel roll in your lower back when you're driving to work. So you're not always like sitting in that deep chair because of creep and kind of Stuart McGill's work. We know that makes sense. So, but also maybe we can get up every 20 minutes at our desk and just do a couple back bends or press ups. Like maybe that'll just tackle just that one category. If you do that consistently throughout the day, and the next one, you're like, okay, I'd also like to give you a little bit of like basic core exercises, because we think that that's pretty helpful too, based on some of the literature, whether that's true strengthening, probably not, but just desensitization or just, loss of fear of movement or whatever it is. So we'll give them a couple bird dogs or like something basic like that. And the third thing is like, okay, your hips are also pretty stiff. Maybe we should work on that too. And you give them like one or two hip stretches based on what you think is important, right? And so you have a program that has two or three things that are really important and a few exercises to do consistently, versus being like, okay, you have a hip thing, an ankle thing, a thoracic spine thing, a core thing, a glute thing. We're going to give you 9 exercises for 9. You have to do them 4 times a day. And you need PT 2 times a week for the rest of your life. Like that's like, all right, I'm never coming back. Good luck. You
Yeah.
Eat the rope. Just like the same thing with their gymnastics question that they get from the door.
Okay, cool. This is switching directions just a little bit and kind of going to piggyback off of Kevin's question earlier. And his was in regards to discharging and kind of discharge planning. And obviously, transitioning an athlete, I primarily work with athletes, so most of my questions are in regards to athletes, but just transitioning someone to a strength and conditioning program. Like, you guys at Champion have a really great model where, they can come and see you and then immediately walk right next door and do their strength and conditioning program. And you guys talk about their program, what needs to be, any modifications, stuff like that. If you, per se, like have that relationship with a strength and conditioning coach, but also like, not right next door to each other, how do you, and at what point in their program do you actually transition them to a full strength and conditioning program with a coach versus with you and like coming to like formal therapy sessions?
Yep. Good question. I think that there's kind of like a 4-phase progression to rehab that every injury has to go through, right? So you have like the initial, oh crap, damage control, put the fire out kind of thing. You have the secondary, which is just like be a normal human again. Can you like walk upstairs? Can you pick up stuff off the ground? Can you just sleep comfortably, right? So you get through that. Then you have that third phase, which is everybody should be an athlete. So everybody should do some sort of weightlifting, pushing and pulling and hinging and stuff. And so if that goes well, then you have to become your actual athlete again. So usually once you're through those first 2 phases and someone has good range of motion, their pain is minimal, they're tolerating things pretty well, and like you're getting into the gym a little bit more, or they're at home and they're doing more advanced exercises, they're going back to their fitness gym, we kind of have that idea that maybe they're on that third phase, and that you start having that conversation about like, all right, well, I think you're probably ready to do some more gymnastics basics or some strength basics, or for like, pick a ball up and just do like some very easy catch or something like go for a jog twice a week and see how you respond to some of that. So you kind of open that door of that conversation. And if you're not the person to do it, or you don't have the facility to do it, that's when you have to start getting a strength coach involved or a sport coach involved and say like, hey, we're coming up to a point where I think that we're probably going to be able to help somebody get back to this, but we're just not right there yet. We just need to kind of like cross over a little bit here. They're not quite done with PT at the advanced stages, but they're not quite ready for the beginning of their sport. And so you develop a plan that kind of overlaps them in the gray there and kind of feeds them back. So like a gymnast would go in maybe a couple times per week and they would do their strength program and some basics, right? Or a baseball player would go back and do all their strength stuff and they would just do a light toss program. So you start building that program from there. And you slowly ramp them back up, back to Kevin's thing about their goals, right? If they can start doing basic unloaded movements without too much pain or symptoms, you start them on loaded movements and see how they respond. Just like with this, if they can tolerate advanced, power work and jumping and lifting in the gym, you're probably ready to start teasing out some of those sport basics. And if they tolerate that well, you just kind of ramp the program up more and more and more based on, whether their goal is just to deadlift heavy or whether their goal is to do a, Yurchenko, or whether their goal is to throw 90 miles an hour, whatever their goal is, you just kind of slowly build them up.
Okay.
Yeah.
Have you ran in what?
You're always tinkering. Sometimes you like expect it to go well and you push them and they get super flared up and you're like, okay, we weren't ready yet. So just have that conversation beforehand.
Okay.
Like, you might have an issue. This is why we're going to only go 2 days per week, and prep that beforehand and don't get scared of that when it comes back in.
Okay. Have you ran into the problem? I know maybe this was, a question for prior to you working at Champion, but did you run into the problem where it was just a lot for an athlete to come to you, go to a strength, like if we are at that point where they would come to you maybe once a week, a strength and conditioning coach once a week or twice a week, and then still being in the gym or at a sports practice where like that's just too much for them? Like I feel like, we're trying not to overload their system too much, but yet we're still like hammering all these, different things on their schedule. So I guess like how did you handle that?
Yeah, you got to picture at it kind of like fader dials, right? So you got to picture like, okay, we have like our PT, we have our strength conditioning, and then we have maybe our sport specific stuff. And if all 3 fader dials are high, you're going to overload the system. So like in the initial, post-op, whatever it is, you have the PT dials way up, you have the sports way down, and then strength conditioning is right in the middle because you're doing that in PT. And as you kind of get more along your rehab, it maybe just shifts even where you're like, okay, now we're doing more loading in the gym, more loading in the clinic. And maybe we add 1 day of a home program with a strength conditioning emphasis. And then maybe we get back in the gym a couple of days per week and we do a little bit more, but we're not going 5 days a week to our practice or whatever it is. And then as you kind of get farther along, it tips more and more the other way where it's like, okay, we're going to pull back to once per week for PT, or once every 2 weeks, we're going to do 3 days of a home program. We're going to get back in the gym 3 days. Right. And it starts to kind of angle the faders up the other way because it's all about the optimal dose, right? It's all about playing with the tinkering of the dial, so to speak, to make sure you're not overloading it. There's only so much room in the cup to fill it with water. And if you're pouring so much in workload, it's going to overflow. And so you have to kind of like acknowledge that the fact that over 6 weeks, we're going to go less PT, more strength, or more, whatever it is. And usually when we have someone who's in that strength conditioning phase or that advanced phase, we say like, we're going to plan for 6 weeks. We're going to have, 2 days of PT like we had initially. And then as soon as we're ready, we're going to bump to 1 PT, but you have more homework to do. And then in 2 weeks, we're going to add a strength session. And then in 4 weeks, we're going to add you back in the gym. Like people kind of understand like, okay, there's a plan here. I understand where I'm going, and they can monitor their symptoms kind of as they go.
Okay.
Does that make sense?
Is that, yeah. Is that a conversation that I mean, obviously you would need to be in contact with the coach, communicating about everything that you were doing at PT and kind of expectations in the gym, but just telling them that, at that point, the expectation is for them to go to a strength coach instead of going to practice.
That's the hope, right? That
right.
Ideally, we always talk about ideal situations. Like in an ideal world, we would like to have you work with this great strength coach that I know and do some more harder programs with me. And then, we'll get your coach involved, for support coach involved to kind of get you back in the gym. Sometimes it doesn't always happen and you don't have a strength coach, and you have to say, okay, well, in that case, then we're going to get you back into the gym, but we're going to be doing 2 hours of practice with an hour of that being your PT and your strength program and some basics. And then we'll bump you up to 3 hours or another day per week or something like that. So I think that's another situation where it's always so important to talk from the very beginning about what are their goals, what do they want to get back to, and can we involve all parties, right? Can we have an email chain with all of us? Can the mom, you, and the strength coach and their dad have a group text or a group email chain that you guys all are on the same page? Because when I make programs for people, even when it's the early PT stuff, I usually make a Google Doc and I share it with all those people because they're all on the same page. They can edit those things and ask questions, but then also they see exactly where we're coming from over the course of 4 months or so.
Okay.
Makes things much easier when you get down to the end stage.
Yeah, definitely. I feel like as a new grad, it's hard to have you just like put all the pieces together, and like have that communication with the gyms and the girls and the parents. And, but your Google Docs have helped. I've been practicing the Google Docs and trying to fill it in. It's very helpful.
You also have to just be prepared to take some like lumps on the chin. You know what I mean? Like when you're a new grad and you're super young and like you're dealing with sport coaches who are like 50, 60 years old and they've been in the game for a long time or whoever it is, or parents or coaches or whatever it is, you have to realize that they're just going to kind of crap on you a little bit. Like, oh, what do you know? You're just at a school. You barely did anything, blah, blah, blah. And you just got to like take that like a champ, especially patients sometimes do that too. They're like, oh, this girl's kind of young. I don't know if she knows everything what she's talking about, so everybody goes through that kind of growing pain, but that's when it has to be like, you do the best you can to read the literature, be up to date, be a good person and just do what's best for them. And like most of the time, people that you're work hard and be nice to people. It's a good slogan that like most people will let that stuff roll. You'll get a few bad eggs here and there, and you just let that slide.
Okay, cool. Thank you. I have, I think, one more question, and it's kind of just a general, I know you deal with a lot of overuse injuries, especially in gymnastics, but just generally kind of rule of thumb. I know it is very dependent on the specific type of injury you're working with, but how do you deal with activity modifications away from the gym, like exercise in general, whether it be a runner, whatever, if they're having pain from an overuse type injury, because their number one question is going to be, well, what can I do?
Yeah. And they never want you to be, shutting them down or things like that. The first piece of it is always trying to focus on back to goals, what's going to be the optimal path to their long-term goal. So in the short term, you have some things you'd like to get back to, but in the long term, like, what do you really care about? What's the biggest thing that's most important? So in gymnastics, a lot of athletes I work with, it's like, oh, I want a scholarship. I want to compete in college. I want to go to elite qualifier, whatever it is. For some of the other sports, it's like, I want to get drafted. I want to, there's a lot of different long-term goals. And you kind of say, like, okay, if that is the long-term goal, let's look at the macro here of like, we could get you back in 2 months and we could get you really quickly back to this, gym practice, competition, meet, whatever it is. But the risk of something going poorly is much, much higher unless we could wait, maybe 5 months or 6 months to this thing for real and get you back, later for your long-term goal. And Tim Gabbett has a really good phrase. It's like, I'd rather get you back permanently than quickly. And I think that when you have that time frame in your mind about like what the long-term goal is, people are a little bit more receptive to that. And the second piece to that is you have to focus on what people still can do. Try to build programs around all the things they can do and what can still happen. So you're not just focusing on like all the things you're pulling off the table. So, I think like post-op's a great example when people have an ACL and you're like, they think they're like a rehab patient. They're like, oh, I'm so laid up, I can't do anything. And like as early as like 2 weeks, we have people on a bike with their operative leg on a resting spot and just using 3 limbs, their arms and their legs. There's still tons of arm stuff, tons of core stuff they can do that they don't have to use their leg for. And if you frame that conversation more on all the things that you're going to fill in the gap, like, yeah, unfortunately, you can't throw right now. You can't go to the gym. You can't tumble. You can't run right now because that's maybe just a little bit too much. But here's all these things that we can do. We'll help you build a program and we'll do a lot here. I think it gives them a little bit of hope in terms of how to get there. So if they know that their time and their patience and their work will get them to their end goal, and they have strategies to fill in the gaps, like a lot of athletes will still just go to practice early and do the best they can and be with their team, but then do their basic PT or their basic rehab or do stuff that's cleared by the doctor or by you. They still feel like, okay, I'm not all the way there, but at least I'm not, sitting on my couch doing nothing right now.
Mm-hmm. Cool.
Yeah. And comes a time and skills to just develop programs like that. That's where you need people to help you out. Like, what would you do with an ACL 2 weeks out? Or what would you do with somebody who has low back pain, and can't really do stuff? You can probably stay back and do a lot of exercises. So there's ways to go about it, but that's why studying some of that stuff in the strength and conditioning is so important.
Mm-hmm. Cool.
Yep.
That helps. I think that's all my questions. I do have one last question.
God,
do you have a mask for the COVID prevention, of course, with Marvel?
No, that would be solid though. Can you imagine having like the Iron Man plate to be?
That is what I imagine you wearing right now.
No, boring standard N95 that we got because if we see a patient who's like had surgery and we have to go in or something like that, that would be sick. Is there any company? That's what we need right now. We need a company. I feel like the pediatric hospitals of the world have these because they have really cool.
They have to. Yeah, I mean, I know a lot of people are making masks just out of t-shirts and putting it over their N95 mask to protect it. So
we need one that are medical grade and block 95% of the virus, so we can wear those at the clinic.
True.
New business right here. You can make a new business.
Exactly. Start a social media page.
You got it. Well, sweet. Well, thank you so much. I
appreciate it.
Crushed it. And I hope you guys stay safe in the COVIDness.
Thank you. You too. Thanks for having me.
See ya.
Bye.
Yeah, look at us go. Dang, we are almost out of time here. Becky, we did it. I think we did all right. I think we had a lot of people in the live stream. They're enjoying it. Do we have anything else we got to cover here before we sound off? Kevin submitted the question after the question. This is good. How do you block out time to read other books that aren't related to the business or PT? Do you read novels? That's funny. So I don't read anything that's nonfiction. Like personally for me, I don't like to read like graphic novels or stuff like that. I personally like to read my business stuff or like that kind of things. But my like spaced out downtime is usually through like movies or TV shows, or like we were just talking about Marvel, like all that kind of stuff. So I usually try to block out time at the end of the day to kind of give myself like a half hour or an hour to kind of calm down and just chill after I get to work. I try to be better about not having like ridiculous hours. In the very beginning, I was working way too much between the company and between coaching. I was working like 80 to 100 hours a week, and it was just way too much. As I've gotten farther along and I feel like the company has built and stabilized, I can spend more time for myself. And I think for my mental health, it was better. So now, I'll like I said, I'll have an hour in the morning where I'm not really doing anything business related, and I'll wake up, and enjoy that time. But then I'll, kind of go at it from like 7 or 8 to usually like 8 or 9 when I get home. But then I'll always have like, an 8 to 9 block where I'm just like hanging out, chilling, doing whatever I want. And then I'm getting much more strict about like, Saturday after practice and Sunday are just my time to do whatever I want. Or like I said, Friday or Saturday night, going out with friends and doing stuff like that. So have to build that into your schedule, because most people like me usually will just work and work unless they have a hard deadline. So not always easy. But I do not read novels. I usually watch TV or movies or things like that. So Kevin crushed it with the questions. Thank you much. Thank you to everyone who joined us today. I think that was pretty solid. Do we have more? Is there more? Did I miss one, Beck, or are you good?
You are good.
Yeah, we did it. Everyone in the comments section, say thank you to Becky for running the madness that I didn't have to do, which was great. And I could just focus on answering questions. So I think we made it as a success. Guys, if you like this, it's going to be recorded on YouTube, so you can go back and watch it. It'll be in Facebook for about a day. And I think this is good. We have a bunch more questions that came in through comments and stuff that I hope these people reach out to Becky. If you guys want a question asked, you want to come on virtually and ask, Becky at shiftmovementscience.com. She's going to be the one coordinating the next episode. And I think the plan is to do it next Tuesday. We'll talk about that if this is something that's worth it. If we get a lot more questions and people can do it, maybe we'll do it bi-weekly, but whatever people need. If we have enough questions, I'll do it. I mean, I have the time in COVID, and Becky loves starting her morning with a way to talk to the world. So I think we got it. So guys, thank you so much. I appreciate everyone asking this stuff, and I hope they were helpful. But until now, I think we'll probably just plan on seeing you guys next week, Tuesday evening. So have a good night. Stay safe. Have a good morning. Have a good day. Stay safe in the craziness of COVID. And We'll catch you guys on the next episode. Peace.